years old. So અત્યારે તો ખાલી લોકમિંગ ને એવું કરું છું ને બીજું મેડિકલ સ્કૂલમાં ટીચિંગ કરું છું અને એક્ઝામિનિંગ અને ઇન્ટરવ્યુઇંગ થિંગ્સ લાઈક. આજે ટોપિક છે બ્લડ પ્રેશર. તો માણસોને બ્લડ પ્રેશરનું નામ દે એટલે બહુ ગભરાઈ જાય ઘણીક વાર. તો ગભરાઈ જવાની કાંઈ જરૂર નથી. બ્લડ પ્રેશર બધાને જ હોય. Alright? તમે અત્યારે મારું બ્લડ પ્રેશર માપું અત્યારે તો જરાક વધી જશે બીકોઝ ઘણા માણસની સામે વાત કરું છું. અત્યારે પછી બેસીને ફૂટબોલ જોઈશ તો કદાચ ઓછું એ થઈ જાય. બહુ મેન્ચેસ્ટર યુનાઇટેડને જોઈએ તો ત્યારે બ્લડ પ્રેશર પાછું વધી જશે મારું. એટલે તમારે બ્લડ પ્રેશર માપો, હું તમને કહીશ કેવી રીતના માપવાનું, ક્યારે માપવાનું. બહુ વરીઝ નહીં કરવાની ને 5-5 મિનિટે બ્લડ પ્રેશર નહીં માપવાનું બીકોઝ એ છે ને બ્લડ પ્રેશર હોય તમને, હું તમને કહીશ કેવી રીતના માપવાનું, શું કરવાનું. એ ઇઝીલી ટ્રીટેબલ છે. ઓકે, આપણે ઇન્ડિયન્સમાં એ ટ્રીટેબલ મચ ઇઝીયર, પણ તમે કોઈ ફેમિલી કે ફ્રેન્ડ્સમાં હોય આફ્રો કેરેબિયન, એ લોકોનું બ્લડ પ્રેશર બહુ ડિફિકલ્ટથી ટ્રીટ. એ લોકોને ઘણી વાર 4 કે 5 જાતના દવા આપવા પડે. પણ બ્લડ પ્રેશર ઇઝ ઇઝીલી ટ્રીટેબલ. તમે તમારો જીપી કરી શકે. અને તમને કહીશ પહેલા કે કેવી રીતના તમને કહું છું તો તમને થોડીક સ્લાઇડ્સ બતાડું બ્લડ પ્રેશરની. So I'm just going to share some slides. Screen. Start broadcast. તમારે ક્વેશ્ચન પૂછવો હોય તો પૂછજો. તમને એડવાઇસ આપું છે ને, તમારે મેઇન એડવાઇસ તમારા જીપી પાસે જવા પડે બીકોઝ તમારા જીપી નોઝ યોર પ્રોબ્લેમ. ઓકે, તમારા જીપી જાણે તમારી મેડિકલ હિસ્ટ્રી. હું તમારી મેડિકલ હિસ્ટ્રી નહીં જાણું એટલે તમને જનરલ એડવાઇસ આપી શકું કોઈ દવાનું કે આમ કે શું કરવાનું. પણ તમારા ઇન્ડિવિજ્યુઅલ જો પ્રોબ્લેમ થતા હોય બીકોઝ તમારી મેડિકલ હિસ્ટ્રી કોમ્પ્લેક્સ હોય કદાચ, હું પછી દવાની વાત કરું કે તમને કહું કે આ કરવાનું છે તે કરવાનું, એ તમારા જીપી સાથે પછી તમને પ્રોબ્લેમ થાય. પણ તમને લાગે આ ટોક ઉપરથી કંઈ પૂછવું હોય તો પૂછજો મને. બટ હું તમને કહું પહેલેથી જ કહી દઉં છું કે એ છે ને ઘણીક વાર ડબલ તમને એડવાઇસ મળે ને તો ઇટ્સ અ બિગ પ્રોબ્લેમ. ઓકે, પણ પ્રોબ્લેમ થતો હોય તો દીપકભાઈ તમે જોજો, કોઈને ક્વેશ્ચન પૂછવો હોય તો મને કહેજો. ઓલરાઈટ?
Yeah, I've message મૂક્યો છે chatમાં. કોઈને ક્વેશ્ચન પૂછવું હોય તો chatમાં લખી લઈ, નહીં તો છેલ્લે end of presentation hand up કરે તારે છે પૂછાય.
Okay, I'm quite happy કે ઘણી question સ્લાઇડમાં કંઈક પીપલને કન્ફ્યુઝન લાગે I can stop there. It's not a problem. All right, we got 1.5, nearly 2 hours. All right.
Okay, yeah, no problem.
So I can talk because જ્યારે મનમાં આવી જાય question, so it's better to ask the question then. પછી 10-15 મિનિટ પછી ભૂલી જાઓ તમે કદાચ. Okay, blood pressure. Now blood pressure is important તમારી health માટે because આજનું ખરાબ, let me just say પહેલા કે આજનું છે ને blood pressure નું problem છે, it's only for 18 વર્ષ and over. All right, યંગ પીપલ હોય 18 વર્ષથી નાના, એના માટે બ્લડ પ્રેશરનો પ્રોબ્લેમ જરાક જુદો હોય છે અને એ છે ને તારા જીપી પાસે જવા પડે. સો હોપફુલી no one is under the age of 18. 80 કોના છે ને very specific problems હોય છે under 18. સો બ્લડ પ્રેશર તમારે કંટ્રોલ કરવા પડશે. હું તમને કહીશ કેટલી લેવલ ઉપર કરવા પડશે. અને બ્લડ પ્રેશર તમારું જો આસ્તે આસ્તે વધે એ તરત ને તરત નહીં પ્રોબ્લેમ કરે. મારી પાસે ઘણા માણસ આવે, માથું દુખે જરા કે મને માથું દુખે, પ્રેશર માપો ડોક્ટર, પ્રેશર માપો. The chances are 99% કે એનું હેડેક્સ બ્લડ પ્રેશરને લીધે નહીં થાય. ઓકે, પણ તમારે લોંગ ટર્મ બ્લડ પ્રેશર રહે તો તમને બોડીમાં હાર્ટ એટેક્સ થાય, સ્ટ્રોક્સ થાય, એટલે લખવો થાય. અને મોર ઇમ્પોર્ટન્ટલી તમારી કિડનીઝ જતી રહે આસ્તે આસ્તે. તમને નહીં ખબર પડે જ્યાં સુધી બ્લડ ટેસ્ટ કરે ત્યાં સુધી ખબર જ નહીં પડે કે કિડનીઝ તમારી જતી રહે. ને પિશાબમાં ખબર પડશે, હું તમને કહીશ કેમ માપવાનું. અને ઘણીક વાર હાર્ટને એટલું બધું ડેમેજ કરે કે તમને હાર્ટ ફેલિયર થઈ જાય, એટલે શ્વાસ ચડશે, પગના સોજા આવશે, ખાટલામાં બેડમાં બેઠા હોય તો સુવાય તો 2-3 ઓછી કરવા પડે, ફ્લેટ નહીં રાખી શકે તમારા બેડ, રાતના બહુ શ્વાસ ચડે. ઓકે, સો હાર્ટમાં હાર્ટ ફેલિયર થાય. અને પછી સ્ટ્રોક્સ તો વાત કરી છે. જે બ્લડ જ્યારે ક્રોનિક બ્લડ પ્રેશર રહે તો તમારી આર્ટરીઝ છે ને હાર્ટ થઈ જાય માથામાં, અને કોઈક વાર બ્લીડિંગ પણ થાય હેડમાં. અને ઇટ્સ રેર કે હાઈ બ્લડ પ્રેશરથી થાય. અને કિડની ડેમેજ થાય તો કિડની તમને પિશાબમાં અમે ચેક કરી શકીએ જીપીસ, ઓ તમારા કિડનીના બ્લડ ટેસ્ટ પર. ને આંખની પાછળ પણ તમને પ્રોબ્લેમ થાય. ના આજે પ્રેગ્નન્ટ લેડી લોકોની વાત નથી કરવાનો, પણ તમને ક્વેશ્ચન હોય તો હું તમને આન્સર કરી શકું. બીકોઝ ધ પ્રેગ્નન્ટ લેડી હોય ને એ લોકોનો બ્લડ પ્રેશર થાય વધારે, it's dangerous for the ladies mate and it's dangerous for the baby in the stomach. All right, See, this is a very serious problem. પણ તમને પારખવું હોય તો હું તમને કહીશ કે રીતના પારખી શકો. આ તમારી આંખ પાછળ ડોક્ટર તમારી લાઇટ કે ઓપ્ટિશિયન પાસે જાઓ તો આંખની કેમેરા નાખીએ આમ કરે લાઇટ પાડીએ તો આવું દેખાય, આ નોર્મલ દેખાય. પણ તમે આ ફોટો જોયો તો જ્યારે તમારું બ્લડ પ્રેશર આસ્તે આસ્તે વધે તો આવા બ્લડ પ્રેશરનું છે ને તે ડેમેજ બતાડે છે. આમાં ધોળા ડાઘા છે એમાં લીકેજ થાય, પ્રોટીન લીકેજ. લાલ ડાઘા છે લેફ્ટ હેન્ડ સાઈડમાં ઉપર ફ્લેટ એરોની ઉપર, એ લોહીનું બ્લીડિંગ થાય. Now, આંખની people worries નહીં કરે because they are worried about heart attacks and strokes, blood pressure. પણ તમે આસ્તે આસ્તે આંખ બગડે તો પછી તમારી સાઈટ જતી રહી. ડાયાબિટીસથી આવા જ પ્રોબ્લેમ થાય, પણ જરાક જુદા હોય છે. એટલે બ્લડ પ્રેશર હોય તો તમારે ઓપ્ટિશિયન પાસે એટલીસ્ટ વર્ષમાં એકવાર ચેકિંગ કરવા જવા પડે, જીપી ના કરે તો. સો દેટ્સ ધી આઈ પ્રોબ્લેમ. નોર્મલ દેખાય અને આ જો કેટલું જુદું દેખાય, ધોળા ધોળા ડાઘા દેખાય છે, આ લેફ્ટ હેન્ડ સાઈડમાં બ્લીડિંગ દેખાય છે. અને તમને ખબર નહીં પડે પણ આ બાજુ રાઈટ હેન્ડ સાઈડમાં ગોળ બતાડે છે ને, ત્રીજો એરો છે નીચે, ત્યાં સોજો છે. અને બ્લડ વેસલ છે ને બધી, આમાં જો આ બ્લડ વેસલ બધી સ્મૂથ લાગે અને આમાં છે બ્લડ વેસલ બધી ફેટ. એ તમને નહીં ખબર પડે પણ ડેમેજ થઈ જાય પછી ખબર પડે. એટલે ઇટ્સ ઇમ્પોર્ટન્ટ કે તમને કોઈ કહે કે બ્લડ પ્રેશર છે તો તમારે જીપી પાસે જવાનું. જીપી ના પાડે કે એને એક્સપિરિયન્સ નથી આંખની પાછળ જોવું તો તમે ઓપ્ટિશિયન પાસે જાઓ. ઓપ્ટિશિયન પાસે એટલા ફાઇન કેમેરાઝ હોય છે ને, બધી ઓપ્ટિશિયનમાં એ લોકો પાસે સ્કેન કરે, ઓસીટી સ્કેન કરે એ લોકો, સ્પેશિયલ આઈનો સીટી સ્કેન. એ કદાચ પૈસા આપવા પડે, મને લાગે £25, but it's worth it once every couple of years કે તમારું બ્લડ પ્રેશર કે ડાયાબિટીસ હોય તો ફોટો પાડી તો ખબર પડી રહે અને રેકોર્ડ હોય તમારો. ઓકે, ના બ્લડ પ્રેશર તમે માપો.
Harish bhai,
Yep.
Just one question that's come in, if you don't
Yeah,
mind.
go on. I can't see the question. So I'm
Yeah. When you say long term, what's long term? How long?
Okay, long term can be anything from 5 to 10 years or more. Okay, unless તમારું બ્લડ પ્રેશર જબ બહુ હાઈ હોય ડાયગ્નોઝ કર્યો ત્યારે, હું તમને નંબર્સ આપીશ પછી, તો જ્યાં સુધી એ ટ્રીટમેન્ટ ના કરે ને તો બોડીમાં આસ્તે આસ્તે ડેમેજ જ કરે. ઓકે, સો લોંગ ટર્મ ઇઝ મોર દેન 5 to 10 years, I would say. Alright, અને જો ઇમિડિયેટલી ડેમેજ થતી હોય હાર્ટમાં કે બ્લડ પ્રેશરથી આંખમાં કે કિડનીમાં, એનો મીનિંગ કે તમારું કિડની બ્લડ પ્રેશર કંટ્રોલમાં નથી આવ્યું એટલે. But usually doesn't happen in 5-6 years, 5 to 10 years. Okay, so is that okay? Okay, all right, correct. તમે છે બ્લડ પ્રેશર માપો તો કેવી રીતના માપવાનું? ફર્સ્ટ ઓફ ઓલ તમારે બ્લડ પ્રેશરનું મોનિટર જોઈએ. આંકડા ઉપર તમે પહેરો બ્લડ પ્રેશર કે આંગળી ઉપર, એ તમારું એડવર્ટાઇઝિંગ આપ્યું હતું જસુબેન ને કિશોરભાઈ, એમાં બતાવે છે કે આ રિસ્ટ ઉપર ફોટો બતાડી, એ છે ને બ્લડ પ્રેશરનું રિસ્ટમાં તમારું બ્લડ પ્રેશર ખોટું આવશે. એટલે બેસ્ટ બ્લડ પ્રેશર અહીંયા આમમાં બતાડશે. બીકોઝ આ બ્રિટિશ હાર્ટ સોસાયટી અને બ્રિટિશ હાર્ટ ફાઉન્ડેશન એ રેકમેન્ડ કરે છે કે આ બેસિક મશીન છે ઓમરોન M2 કરીને £30 મળે છે. તમે અફોર્ડ કરતા હોય તો એ બાય કરો. And this will measure, અને ઘણી વાર તમે મેજર કરતા હોય તો બ્લડ તમારી પલ્સ રેગ્યુલર હોય કે ઇરેગ્યુલર હોય ને એ પણ કહેશે. તો ત્યાં હાર્ટ હોય ને આમ જીક 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 થશે હાર્ટ, એનું નામ છે એટ્રિયલ ફિબ્રિલેશન. એનાથી હાર્ટ ફેલિયર થાય ને સ્ટ્રોક્સ થાય. એટલે machine is good machine, but that's a better way to measure the blood pressure than wrist or finger blood pressure. Okay. So advertising કર્યો તો ત્યારે આવો ફોટો હતો, પણ તમે આવી રીતના બ્લડ પ્રેશરનું મશીન હોય, it's not good. Okay, you need to invest in proper machine which looks like this. Okay, and as I said, તમને કે £25 to £30 તમને એમેઝોનમાં મળશે. So that's the first thing. And પાછળ લખ્યું હશે કે CE એટલે kite mark, it's better.
હું જોયા હું તો જોયા છે મારું.
કેમ છો? ઓકે, રાઈટ. પછી અહીંયા પાટો મારીએ આમ ઉપર, એને કફ કે. એ કફ ઉપર તમારે છે ને પ્રોપર સાઇઝ, એટલે તમે નોર્મલ સાઇઝ આમ હોય તો 22 to 32 સેન્ટીમીટર બતાડીશ કેવું. પણ તમે આમ જરાક આપણાથી જરાક વજન વધ્યું હોય કે મસલ્સ બહુ હોય તો એનું કફ મોટું કફ જોઈએ, એના 10 પાઉન્ડ વધારે આપવા પડે તમારે. અને આ કફ હોય છે. અને નોર્મલ સાઇઝ તમે વાપરો કફ is normally 22 to 44 most people. જરાક તમારા આર્મ્સ જરાક જાડા હોય, ફેટ હોય કે whatever, તો તમારે નીચે વાળું છે ને જાડુ કફ નો જોઈએ. નાના કફ ઇઝ ઓનલી ફોર ચિલ્ડ્રન એન્ડ થિંગ્સ, રાઈટ? સો રિયલી આઈડિયલી બધાને 22 થી 44 સેન્ટીમીટર નો કફ છે એ લેવા પડે. એ તમારે જે મશીન લેવો તો એ સ્ટાન્ડર્ડ કફ જ આપશે તમને. ઓકે, પહેલી વાર તમે બ્લડ પ્રેશર માપો તે બે સાઈડમાં પડે, લેફ્ટ સાઈડમાં માપવા પડે ને રાઈટ સાઈડમાં માપવા પડે. અને જે 15 મિલીમીટર થી વધારે હોય બ્લડ પ્રેશર એક હાથમાં, તો ફ્યુચરમાં તમે એ સાઈડ થી જ વધારે, જેમાં વધારે હોય બ્લડ પ્રેશર એ સાઈડ થી જ માપવા પડે. હું યુઝલી બ્લડ પ્રેશર માપું પેશન્ટમાં તે રાઈટ સાઈડ જ માપું. આફ્ટર એકવાર માપ્યું હોય તો બ્લડ પ્રેશર માપ્યું હોય ત્યાં પછી. એટલે સમજ પડી? પહેલી વખતે માપો તમે બ્લડ પ્રેશર તો બે સાઈડ કરવાનું, પણ એક સાઈડમાં 15 મિલીમીટરનું ઉપરનું વધારે હોય તો એ સાઈડ જ બ્લડ પ્રેશર તમારે ફ્યુચરમાં વાપરવાનું કામમાં. ઓકે, યુઝલી મારી પાસે પેશન્ટ્સ આવે, મારું પોતાનું બ્લડ પ્રેશર માપું, હું 3 વખત માપી શકું. ઓકે, એવરી ટાઈમ 5 મિનિટ લાગે પણ 3 વાર કરવા પડે. જીપી માટે આવી આમાં ત્યાં તો પેશન્ટને હું કહું કે 5 મિનિટ 2-3 મિનિટ સુધી વાત નહીં કરતા અને 3 વાર માપું બ્લડ પ્રેશર. એ 3 માંથી રીડિંગ જે ઓછામાં ઓછું હોય ને એ મારા નોટ્સમાં લખું, નકર મારું પોતાનું માપતો હોય તો મારા પોતાની કમ્પ્યુટરમાં કે ફોનમાં લખી દઉં 3 ટાઈમ્સ. તમે કેમ છો કેમ કે મારી પાસે ઘણી વાર માણસ આવે 15-20 મિનિટ, કોઈ 40 મિનિટ વેઇટ કરતા હોય, એટલે એ લોકોનું મૂડ વધતો જાય, ગભરાઈ થાય કે ડોક્ટરને આમ કહેવાનું છે તેમ કહેવાનું છે, એટલે એ લોકોનું બ્લડ પ્રેશર વધારે હોય. પણ તમે ત્રીજી વાર માપો તો બ્લડ પ્રેશર ઓછું થઈ જશે. ઓકે, તમે ડોક્ટર પાસે જાઓ, હોસ્પિટલમાં જાઓ, સ્પેશિયલ ક્લિનિકમાં જાઓ, બ્લડ પ્રેશર ક્લિનિકમાં, ઓર તમે હોસ્પિટલની ક્લિનિકમાં જાઓ, કેઝ્યુઅલ્ટીમાં જાઓ, તો ઘણી વાર છે ને બ્લડ પ્રેશર તમારું વધારી જશે. ઓકે, એટલે 3 વાર માપવા પડે. તમારે જીપી પાસે જાઓ ને પહેલી વાર માપે ને નોર્મલ હોય તો 3 વાર નહીં માપવા પડે. તમને જીપી પહેલી વાર જ માપે ને કે તમારે આજે બ્લડ પ્રેશર વધારે છે 160 ને 90, તમારે એમ કહેવાનું ડોક્ટર આસ્તેથી, ડોક્ટર તમે બીજી વાર પાછળ માપજો. ગમશે નહીં ડોક્ટરને, બીકોઝ ડોક્ટરને ખબર ને કે એ લોકો જ બોસ છે, પણ તમારે એમ ડોક્ટરને બોસ નહીં બનાવવાના, બીકોઝ બધા ડોક્ટર હેઝ ટુ લિસન. અત્યારે આ વર્ષે જ અમારા મેડિકલ કાઉન્સિલનો રેગ્યુલેશન આવ્યો છે જાન્યુઆરીમાં કે વી હેવ ટુ લિસન ટુ ધ પેશન્ટ. એટલે પેશન્ટ સાથે વાત કરવાની, પેશન્ટ સાથે કહેવાનું અને તમારે અગ્રીમેન્ટ લેવા પડે પછી. એટલે પહેલી વાર બ્લડ પ્રેશર માપીને વધારે હોય તો મેઝર ઇટ અગેન 2 or 3 times. ઓકે, બ્લડ પ્રેશર માપો અને જરાક વધારે હોય તો તમારા ડોક્ટર તમને કહેશે કે પિશાબ લઈ આવજો સર્જરીમાં. આ પિશાબ આવી ધોળી બોટલમાં હશે, લાલ ટોપની નહીં હશે, ધોળી બોટલમાં હશે. ઓકે, અને એ તમે જ્યારે સવારના ઉઠો તે પહેલો પિશાબ કલેક્ટ કરવા આવે, બીજો નહીં, ત્રીજો નહીં, 4 વાગે ઉઠે, 6 વાગે ઉઠે, જ્યારે ઉઠે ત્યારે એ પહેલો પિશાબ ક્વાર્ટર બોટલ હોય તો અને એ પિશાબ એ લોકો પછી તમને હોસ્પિટલમાં મોકલશે, બીકોઝ એમાંથી છે ને આવશે પ્રોટીન. આઈ ડોન્ટ નો ગુજરાતીમાં શું વર્ડ છે પ્રોટીન. જસુબેન તમને ખબર પ્રોટીન ને શું કે? એનો મિનિંગ કે પ્રોટીન આવે યુરિનમાં, એવું સ્પેશિયલ પ્રોટીન તમને કેવી રીતના માપે એ તમારે હોસ્પિટલ જ માપી શકે. જીપી વાળા લાકડીથી સ્ટિક સાથે માપે ને એ નહીં. ધીસ ઇઝ અ સ્પેશિયલ પ્રોટીન અને ACR પ્રોટીન. જેમાં પ્રોટીન વધતો હોય તો એનો મિનિંગ કે તમને કિડનીનો ડેમેજ સ્ટાર્ટ થઈ ગયું છે, એટલે એનો મિનિંગ કે બ્લડ પ્રેશર કંટ્રોલ ઇઝ વેરી ઇમ્પોર્ટન્ટ. ઓકે, બીજા ટેસ્ટ કરે એ પહેલા. એટલે પિશાબમાં આ કરવા પડે ACR ટેસ્ટ. તમે નહીં કર્યો હોય ને તમને ખબર નહીં હોય કે જીપીએ કર્યો છે, તમે લખી રાખજો. નેક્સ્ટ ટાઈમ જીપી પાસે જાઓ તો તમે પૂછી જોજો કે ACR ટેસ્ટ કર્યો છે પિશાબનો. પણ સવારના પહેલી બોટલમાં વ્હાઇટ ટોપ બોટલ અને હોસ્પિટલમાં મોકલવા પડે. એ જીપી તરત કરીને કરે, એમાં જીપી નહીં કરી શકે, એ સ્પેશિયલ ટેસ્ટ આવે ACR ટેસ્ટ. અને એ જોઈ છે કિડનીનો ડેમેજ. તમે જીપી પાસે જાઓ અને તમારો બ્લડ પ્રેશર 140 ઉપરનું અને નીચેનું 90 હોય તે પાછું માપવા પડે 2 થી 3 વાર. તમારા જીપી તમારી મેડિકલ હિસ્ટ્રી જાણતા હશે, એ તમને ગાઈડ કરશે કે વધારે છે કે નથી. ઓલરાઈટ, ના બ્લડ પ્રેશર તમે ઘરે માપો. હવે બ્રિટિશ હાર્ટ ફાઉન્ડેશન ને બ્રિટિશ હાઇપરટેન્શન સોસાયટી એ લોકો એમ કહે છે ઘણાને, ડોક્ટરને પણ, કે તમે બ્લડ પ્રેશર મશીન ઘરે હોય ને તમે રાત મેજર કરતા હોય ને એ અમે તમારી રેકોર્ડ્સ, મેડિકલ રેકોર્ડ્સમાં લખી શકીએ. એ રેકોર્ડ કેટલું બ્લડ પ્રેશર છે ને કેટલું નહીં. બીકોઝ પહેલા તો ખાલી જીપી જ કરતા, પણ હવે મશીન એટલા બધા મળે છે માણસોને, રાઈટ મશીન, કે તમે ઘરે માપતા હોય એવરી ડે કે એવરી 3 દિવસ કે વન્સ અ વીક અને તમને લાગે કે normal છે તો we'll write it down in the computer. Okay, so it's acceptable. તમે બહુ જુવાન હોય.
Harish bhai,
Yep.
just one question that's come up. I
Yep.
think it was on the previous slide. It's from Rina and Jazz Mistry. What is the 15 millimeters? Please explain.
15. Okay. Can you see in this slide 140/90?
Yes.
Yeah. Okay. Now, normal blood pressure should be below that 140/90. Okay. તમે લેફ્ટ હેન્ડમાં કરો 140 બતાડે છે અને રાઈટ હેન્ડમાં કરો 155. The difference there is 15 millimeters. સમજ પડી? Say yes, whoever asked the question.
Rina and Jazz Mistry asked a question. So 15 millimeters is the difference between the left hand taking your measurement on the left
140.
left arm versus the right arm. Is that what you said?
So 140 on the left side, 155. So
Okay.
તમને લાગે કે right side માં જરાક 155 છે, then future blood pressure should be done on your right side, okay, not the left side.
Okay, they said yes.
Yeah,
yeah.
So this is just a guide, all right? Right. Now tomorrow blood pressure, I'll come to proper figures in a minute. તમને GP લાગે કે blood pressure વધુ છે, like young, when I say young, 40 વર્ષથી નાની ઉંમર હોય is young to me, you know. So some of us who are nearly coming up to over 66, we're no longer young, all right? And there are also blood pressure differences for the over 80s, okay? Now, કદાચ GP ને લાગે કે તમે બહુ young છે and he's not sure કે તમે blood pressure, because તમે એકવાર blood pressure ની tablet start કરો and the treatment start karo, it's not for 1 week, it's not for 2 weeks like antibiotic, it's until you're 101 years old. It's forever, all right? You can't start your blood pressure treatment. તમે કરો stops ne start, unless the GP tells you, you will damage your body even more, okay? એટલે stop start ની દવા નથી આ blood pressure ની. So ઘણીક વાર એ લોકો ambulatory blood pressure monitor, that's ABPM, all right? Now it's not suitable for everyone, all right? The ઘણીક વાર તમે ઘર blood pressure નું તમને કીધું હતું ને, home blood pressure measure. So you can do the home blood pressure measurement. તમને પહેલા કીધું British Heart Foundation and British Hypertension Society એ લોકો એમ કીધું છે કે that's acceptable. તમે different times of the day over 1 or 2 weeks તમે લેવો, and if it's persistent. So we can be 2 ways of doing the long-term blood pressure before we start the treatment. Obviously, તમારો blood pressure both severe હોય, which I'll tell you કેટલો number, પિશાબમાં protein ચાલતું હોય, then we have to treat you early, okay? So either ambulatory blood pressure monitor, એ તમારે hospital કે તમારે local clinic માં જવા પડે, or તમે home blood pressure monitor કરી શકો. તમને GP chart આપશે. ઘણી હેરોમાં GPs, બધા GPs પાસે થોડા extra blood pressure monitor હોય, તો we can lend you for a week or 2 a blood pressure machine. પૂછી જોવાનું તમારા GP પાસે હોય, ઘણા GP પાસે. Okay, this is ambulatory blood pressure monitor. તમારે ક્લિનિકમાં જવા પડે, એ લોકો એક પાટો પહેરાવશે, કફ, અને એક મોનિટર તમારે ગળાની રાઉન્ડ પહેરશે અને વાયર જોઈન કરી નાખશે. એ 24 કલાક સુધી પહેરવા પડે. ખાતા ઉઠેલા, કામે જાઓ, જીમમાં જાઓ, રાતના સૂતા હોય, એ 24 કલાક આવું મોનિટર પહેરવા પડે. બધા પહેરે. It's not a big disturbance, right? અને 24 કલાકમાં તમે બ્લડ પ્રેશર માપશે, પછી એમાંથી મશીન લેફ્ટ રાઇટ હેન્ડ સાઈડમાં જ્યાં મશીન છે ટેપ રેકોર્ડર જેવું, એ લેબોરેટરીમાં તમને 24 કલાકનો બ્લડ પ્રેશર બતાડશે. એમાં તમને એવરેજ બતાડશે કે નોર્મલ છે કે વધારે છે કે ઓછું છે. Now, more than 50% of the time જો વધારે હોય, તો it means કે તમારે blood pressure ની ટ્રીટમેન્ટ જોઈશે. Because from my experience, આપણે ઇન્ડિયન માણસોને આપણે કહીએ તમને આમ છે ને તેમ છે, તો કે ના, દવા નથી ખાવી ડોક્ટર, મારે આ ખાવું છે, કારેલા ખાવા છે, આ ખાવું છે, નિમક ઓછું કરીશ, એક્સરસાઇઝ. Really, blood pressure, it's not everything, all right? Blood pressure jo vadare hoy tamne, then you may need treatment. We'll come to that. Okay, this is ambulatory blood pressure monitor for 24 hours. Okay, now doctor tamne કહે કે તમને blood pressure છે, then the treatment will depend on many factors. Okay, તમે 80 થી વધારે ઉંમર હોય, generally weak હોય, બહુ ચાલો નહીં, બહુ exercise ન કરો, ઘરમાંથી બહુ બહાર ન જાઓ, weakness લાગે, so we have to be careful કેટલું blood pressure ને treat કરીએ. એ બ્લડ પ્રેશર બહુ ઓછું કરી નાખશે તે માણસને ચક્કર આવશે, પડી જશે, પછી હાડકા ભાંગશે. ઓકે, ના તમે બહુ યંગ હોય ને બ્લડ પ્રેશર થાય under the age of 40, then you're at higher risk, because ઘણીક વાર family history માં હોય, because there's family history of heart disease, diabetes or kidney, then we have to be what we call very active to treat that blood pressure. Okay, so before we even say તમે કે blood pressure ની દવા ખાવો, this is what we first of all say. તમે જ્યાં exercise નહીં કરતા હોય, ઘણા માણસો અત્યારે કહે છે કે 10,000 steps. That's rubbish. You don't have to do 10,000 steps. તમે ઘરે બેસીને એક્સરસાઇઝ કરો, ખુરશી ઉપર ઊભા બેઠા ગાજી ઉપર 2-5 આસ્તે ચડી શકો. બટ એક્સરસાઇઝ આમ ઊંચા નીચા ખુરશી ઉપર બેસીને કરો, પગ ઊંચા કરો, પગ નીચા કરો. That's plenty for 10-15 minutes. Alright? જ્યાં વજન વધારે હોય તો તમારે વજન ઓછું કરવા પડે. ડોક્ટર્સ તમને હાઇટ લેશે ને તમારું વેઇટ લેશે અને એનો રેશિયો કરશે, એનામાંથી બોડી માસ ઇન્ડેક્સ જોશે. Now usually it should be between about 19 or 20 to about 23-24. વધારે હશે તો તમને જીપી કે નર્સ કહેશે કે તમે આટલું ઓવરવેઇટ છે એટલે આટલું ઓછું કરવા પડશે. એનો મીનિંગ કે તમે ડોક્ટર પાસે નહીં જાઓ ને એમ નહીં કહેતા કે તમારી ઓલી ઇન્જેક્શન જોઈએ છે, મુંજોરો ઇન્જેક્શન, એ આપી શકીએ, પણ only for some people. Okay, બીજું તમે ઘરે શું કરી શકો છો? બીડી પીતા હોય, ભાઈઓ બીડી પીતા હોય, બેન પણ બીડી પીએ છે, ખબર ને, તે બીડી બંધ કરજો. અને આલ્કોહોલ માણસો ઘણા પીએ છે. માણસ ને લેડીઝ લોકો, alcohol limit is about 12 units a week, 12 units to 14 units to men માટે. 1 unit is half a pint of beer, 1 pub shot of whiskey or brandy or whatever. So તમે 6 pint થી વધારે પીતા હોય beer week માં, that means it's too much. All right, so તમે પીતા હોય, I don't want to know તમે પીએ કે નહીં, because it's up to you and your conscience કે તમે ઓછું કરી નાખજો alcohol. Okay, because alcohol, there is evidence research માં કે જે alcohol stop કરશે અને stop smoking કરશે તો તમારી risk ઓછી થઈ જશે. બીજું નિમક. Now નિમક બધામાં ખાવાનું હોય, તમે બિસ્કિટમાં હોય, કેક્સમાં હોય, સમોસા તમે શોપમાંથી બાય કરો, બધામાં નિમક હોય. અને આપણી હેબિટ છે, we don't measure. આપણે રાંધતા હોય ત્યારે આમ સ્પ્રિંકલ કરીએ. લિમિટ હોય છે સોલ્ટની, કુકિંગ સોલ્ટમાં કે 6 ગ્રામ એટલે 1 ટેબલસ્પૂન, નાની ટીસ્પૂન નહીં, ટેબલસ્પૂન જેટલું હોવું જોઈએ once a day. પણ આ તો તમે નાખી શકીએ ઉપરથી. પણ ડોન્ટ ફર્ગેટ કે બ્રેડમાં હોય છે, શાકમાં, બધામાં સુગર સોલ્ટ હશે. ના તમે દુકાનમાં જાઓ અને શોપિંગ કરો ટેસ્કોઝમાં કે વીબીએન્સમાં કે ત્યાં લો સોલ્ટ હશે. ના એ લો સોલ્ટ માં છે ને જુદું હોય છે, એમાં છે ને સોડિયમ સોલ્ટ નથી હોતું, એ પોટેશિયમ સોલ્ટ, and that's just as bad for your blood pressure, right, and your heart. So really whatever salt તમે ખાઓ, low salt કે normal salt, you have to limit it to 6 grams a day. Now હું જ્યારે કોલેજમાં ગયો હતો ત્યારે I stopped after mother આપી હતી ટેટ એન્ડ લાઇનની 2 kilograms ની 1 kilogram ની સુગરની, ખલાસ થઈ ગયા. પછી કોઈ શોપિંગ નતો ગયો ત્યારની. From the age of 18 મેં સ્ટોપ કરી ખાંડ નાખવાની ટી એન્ડ કોફીમાં. હજુ નહીં નાખો. કોઈ મારે ટી એન્ડ કોફી મળે, ખાલી ઇન્ડિયા ઘણી સ્ટેશન ઉપર ઉભા હોય સ્ટેશનમાં ત્યારે પીવા પડે, એ લોકો આપે નહીં તો ત્યાં બહુ મીઠી મીઠી ચાય. પણ અહીંયા ટેવ પડી ગયેલી કે ખાંડ નાખીએ જ નહીં. Now same thing with salt. તમને છે ને હેબિટ પડવી જોઈએ કે સોલ્ટ ઓછું કરી નાખે, because salt is dangerous for blood pressure. Okay, hello, salt is dangerous for blood pressure. Salt તમે કાળજી નહીં રાખો તો it will give you blood pressure problems. Okay, now પછી treatment. Okay, we'll come to treatment. Treatment કરવા પડે એટલે exercise ને એવું કરીએ પછી the chances are that તમારે blood pressure પછી controlમાં આવે. So we want to reduce heart attacks, heart failure, આંખની ડેમેજ, કિડનીની ડેમેજ અને strokes. Okay, heart attack થાય, એકવાર heart attack થાય તો એનો meaning કે તમારું હાર્ટ ડેમેજ થઈ ગયું. ઓકે, ના તમે મોટા ટાઉનમાં રહેતો હોય ને મોટી હોસ્પિટલમાં જાઓ તો વિધિન 4 કલાકમાં તમને એક ઇન્જેક્શન મારે કે આર્ટરી ઓપન કરી નાખે. ઓકે, તો હાર્ટ ડેમેજ ઓછો. ઘણી વાર તમે ગામડામાં રહેતા હોય, 4 કલાકથી વધારે થઈ ગયા હોય, બીકોઝ તમને ખબર નહીં પડી કે આ ઇન્ડિજેસ્શન છે કે હાર્ટ એટેક છે. તો હાર્ટ એટેક પછી ડેમેજ થાય, યુ કાન્ટ રિપેર ધેટ. ઓકે, ઘણી વાર ઘણા હાર્ટ એટેક થાય કે બ્લડ પ્રેશર બહુ હોય તો પછી હાર્ટ ફેલિયર થાય. હાર્ટ ફેલિયર થાય meaning it's different from heart attack. Heart failure નો તમને શ્વાસ ચડે. ચાલતા હોય ગાજી ચડો તો હાંફતા હાંફતા ચાલવા પડે. રાતના સૂતા હોય ત્યાં 2 થી 3 ઓશિકા ઉપર સુવા પડે. ફ્લેટ નહીં સુઈ શકો. પગમાં સોજા ચડે. તમારા લંગ્સમાં પાણી ભરાય. ઓકે, અને કિડની ડેમેજ થાય. એ હાર્ટ ફેલિયર કહેવાય. આંખનો ડેમેજ મેં વાત કરી ને ફોટાએ બતાવ્યા. કિડની ડેમેજની તમે વાત કરી કે બ્લડ પ્રેશર તે થાય. બ્લડ ટેસ્ટમાં ખબર પડે. અને મેઇન ટેસ્ટ છે ઓલું ACR યુરિન ટેસ્ટ, એમ્બ્યુલેટરી ક્રિએટિનિન રેશિયો કે એમાં જે તમારો વધી ગયો હોય, સ્પેશિયલી 30 થી વધી હોય નંબર, that means your kidney is really damaged. Okay, અને સ્ટ્રોક્સ એટલે એક સાઈડ લખવો થઈ જાય. સ્ટ્રોક્સ એ ડિફરન્ટ ટાઈપ્સના સ્ટ્રોક્સ હોય છે. નાના સ્ટ્રોક્સ એ 24 કલાકમાં ક્લિયર થઈ જાય. એટલે જરાક તમને એક સાઈડમાં જરાક વીક થાય, તતરાઈ જાય, પિશાબ થઈ જાય, હાથ વીક થઈ જાય, પણ 24 કલાકમાં જતા રહે. એ ટ્રાન્ઝિયન્ટ સ્ટ્રોક કે એ જરાક જુદી જાતના. પણ એકવાર મોટો સ્ટ્રોક લાગ્યો હોય, કદાચ બ્લીડિંગ થાય બ્રેઇનમાં, કદાચ આર્ટરી બ્લોક થઈ ગઈ, ટાઈટ થઈ ગઈ, એ તમારો સ્ટ્રોક લાગે તો એક સાઈડ તમારે કમ્પ્લીટલી જતી રહેશે. સાઈડ જતી રહેશે, ચાલવામાં જતી રહેશે, એક હાથ જતો હશે, એક પગ જતો. તમે રિલેટિવ્સને જોયું હશે. Now that's dangerous, right? Because that could be lifelong problem.
Harish bhai.
Yep.
One question that's come from Hendra bhai. If we reduce salt intake, do we get cramps?
No, you can't get cramps from salt intake. Okay, it's a myth. All right, people are used to salt, but you have to reduce it. Okay, so cramps, cramp is to do with something different. It's to do with calcium in the blood. All right, not this salt. Okay.
Thank you.
Now, right. So my khali blood pressure problem છે. Strokes નથી થયો, heart attack નથી થયો, kidney damage નથી, and diabetes નથી. તો આવી દવા આપી શકે તમે. તમે બધા આપણે કેટલા છે એટલે 50-60 માણસ હશે, એમાંથી about 50% of the people will be on this. Okay, there's પહેલા બે છે drugs છે. This is the most commonly used drugs for kidney to protect the kidney and protect the heart, and they're called ramipril and enalapril. They're called ACE inhibitors. And the નામ છે છેલ્લું તમે જોવો, that ends with PRIL. બીજા એનથી sister compound આવે છે ARBK, angiotensin receptor blockers, એનું નામ end થાય છે sartan કરીને. બીજા calcium blockers, I think like amlodipine, nifedipine ને એવા. Beta blockers, metoprolol. તમને હાર્ટનો પ્રોબ્લેમ થયો હોય કે હાર્ટ ફેલિયર હોય તો મેઇન ટેબ્લેટ તમને આવશે bisoprolol કે metoprolol આપશે. Atenolol, જ્યારે GP બન્યો 37 years ago, there everyone was on atenolol for blood pressure. But it's not a good drug. The modern drugs are better. It's very old-fashioned drug, but people are still on it. Okay. The ganikwa old people over the age of 80, the first drug we sometimes use is a water tablet. It's called bendrofluozide. Now, this is not giving you permission કે તમને weight વધુ હોય કે આ દવા લેવો. This is specifically for blood pressure for older people, 2.5 milligrams. Now, 5 milligram ni a tablet આવે છે, but it's a waste of time. What 2.5 tablet does is the same as 5 milligrams, and you don't want to be on it. The only slight problem with this tablet, bendrofluozide, which is what we call a water tablet for blood pressure, it can cause your electrolyte imbalance, it can cause gout, and more importantly, it can make your sugar a little bit higher. So anyone who is on that tablet and have got diabetes, you need to go to the doctor and say, I want one or two of the above tablets, either an ACE inhibitors or ARB or amlodipine or beta blocker. We'll go through them in a minute. Okay, so it's only blood pressure. Now, BG medication to my blood pressure, IPO that doctor is something called nifedipine, verapamil, judi jatni છે દવા. ને કદાચ તમને heart problem થયો અને છાતીમાં દુખતું હોય, angina કરને, so they might even give you a tablet called diltiazem. But not everyone is on it. These are not first-line treatment for blood pressure. So તમને blood pressure doctor કીધું હોય ને લાઈનમાં આપ્યો હોય ખાલી આ દવા, ask them, can I have a modern drug? The modern drugs are the top 3 there, all right, or 4. Okay. તમે blood pressure tablet છે, ACE inhibitor and it's ACE inhibitor, angiotensin converting enzyme inhibitor ending with pril, or angiotensin receptor blocker ending with sartan. તમને GP આપશે, પણ ઘણીવાર આસ્તે આસ્તે GP વધારે. Okay. The DP dose change કરે, કદાચ say ramipril આપ્યો, 2.5 milligram and 5 milligrams કરે, so within 2 weeks ચેન્જ કરે તો તમારે બ્લડ ટેસ્ટ કરવા પડે કિડનીનો, બીકોઝ એ છે ને કિડની થ્રુ કામ કરે, અને કિડની થ્રુ કામ કરે એટલે કદાચ કિડનીને નુક્સ પણ કરી શકે બ્લડ પ્રેશરની આ દવા આપે તો. But this tablet is good for the heart, both of these, and it's also good for the blood pressure and the kidney. But because it works in the kidney, you need a kidney test. Okay, right.
Harish bhai.
Yeah.
Harish bhai, one question.
Yeah.
Does any of the BP meds get side effects?
Yeah.
This is from Ramaban.
Yeah. Okay. All of them. Let's go back. All of them have side effects. Okay. So ACE inhibitors, ramipril, enalapril, that sort of thing. જ્યારે તમને પહેલી વાર સ્ટાર્ટ કરે એ દવા તો તમારા જીપી should say કે તમે પહેલી વીક સુધી ખાલી રાતના જ લેજો સૂતી ફેરી. તમે સવારના લેશો બ્લડ પ્રેશર પહેલી વીકમાં તો તમારું બ્લડ પ્રેશર એટલું ઓછું થઈ જશે કે ચક્કર આવશે. Okay, that's the first thing. The other side effect of the kidney is, મેં તમને કીધું કે kidney problem થોડાક વધશે એટલે as doctors we know when to stop the tablet or reduce the dose or something, so we have to watch the kidney test. ACE inhibitors માં બીજા main problem થાય છે ઘણીક વાર now is a little bit of a cough. Okay, now if the cough તમને 3 થી 4 મહિના સુધી ચાલે અને દવા સ્ટાર્ટ કરી પછી then we have to stop the ACE inhibitors because the cough નહીં જાય. All right, so then we might give you something called the angiotensin receptor blockage, જુદો જ then થી ઓછા cough થાય. All right, okay, making sure the kidneys are right. Now the third step, sorry bolo, someone's asking a question. All right, third tablet is amlodipine. Now મારી પાસે આવો તમે તો હું ખાલી 5 મિલીગ્રામની જ ટેબ્લેટ આપું તમને. 10 મિલીગ્રામની ટેબ્લેટ આપીશ તો તમારા ankle કિશોરભાઈ, you have to help me out. What's ankle in Gujarati? ઘૂંટામાંથી નીચેના ankle આવે ને, ankle joint, એમાં સોજા ચડશે હાર્ટ ફેલિયરની જેમ, સ્પેશિયલી ગરમીની વેધર થાય. ઓકે, તો ઘણી વાર જોઉં છું જુનિયર ડોક્ટર્સ હોય સર્જરીમાં તો 10 મિલીગ્રામથી બ્લડ પ્રેશર વધારે પછી 2 વીક પછી પેશન્ટ આપશે કે પગ સોજાઈ ગયા છે, પછી ડોક્ટર વરીઝ કરશે કે હાર્ટ ફેલિયર છે કે કિડની ફેલિયર છે કે શું ફેલિયર છે. એ જો તમે 10 થી 5 મિલીગ્રામમાં જાઓ અને કંઈ બીજી દવા આપો એની સાથે તો તમારા સ્વેલિંગ જતા રહેશે. સો દેટ્સ, અને પહેલી વાર એમ્લોડિપિન થાશો તમે તો ફેસમાં જ્યારે એ છે ને એવી આ બ્લડ વેસલ ખોલે એ લોકો, એટલે ફેસમાં જરાક ફ્લશિંગ લાગે. વિમેનને ફ્લશિંગ થાય ને મેનોપોઝની જેમ એવું ફ્લશિંગ થાય. બીટા બ્લોકર્સથી સાઇડ ઇફેક્ટ થાય ઘણી વાર હાફ લાગે ઓર તમારા હાર્ટ બહુ ઓછું થઈ જાય. એટલે ડોક્ટરને ખબર છે, એ ડોક્ટર પાસે તમે બ્લડ પ્રેશર સ્ટાર્ટ કરો, ઓલોલ કરી લખ્યું છે મેટોપ્રોલોલ, બાયસોપ્રોલોલ, અને પલ્સ રેટ તમારે માણસો ત્યાં પહેરે છે, એપલ વોચ પહેરે, ફિટબીટ પહેરે, 55 થી રેટ ઓછું થાય તો મેટોપ્રોલોલ, બાયસોપ્રોલોલ ને એટેલોનોલનો ડોઝ ચેન્જ કરવા પડે. ઓકે, બ્લડ પ્રેશર પલ્સ ઓછું થાય તો ચક્કર આવે. ઓકે, અને બ્લડ પ્રેશર ઓછું થાય ચક્કર આવે તો there is a risk of falling down. અને બેન્ડ્રોફ્લુઝાઇડ મેં તમને કીધું સાઇડ ઇફેક્ટ થાય છે, it can lower the blood pressure, but it can make you have gout. Your sugar level may go out, and it can also give you uric acid raise, so you may get gout. All right, it happens, but it doesn't happen to everyone. All right, so these are the side effects. Same thing with nifedipine, the same sort of side effects as amlodipine, because they come from the same group of drugs. Verapamil and diltiazem are different. All right, that blood pressure reduction can also affect your heart rate. All right, so we don't use it that often, but if you're on it, then you may well have a heart problem, and that's why you're on it. All right, does that answer your question about side effects? Wave your hand, stick a thumb up. Okay,
I think so.
Okay, our shape, the European Society of Cardiology and the American Cardiac Association કહે છે કે જ્યારે તમને ડોક્ટર સ્ટાર્ટ કરે બ્લડ પ્રેશરની ટેબ્લેટ, તમે પૂછો કે ડોક્ટર મિસ્ત્રીએ 30 વર્ષ પહેલા 20 વર્ષ પહેલા કેવી રીતના બ્લડ પ્રેશર સ્ટાર્ટ, હું એક દવા આપતો પછી આસ્તે આસ્તે એનો ડોઝ હોય જતો. The new regulation આ વર્ષે ઓગસ્ટ 2024 આ કન્ટ્રીમાં આવવાનું છે કે તમે બ્લડ પ્રેશરની દવા આપે તો સ્ટાર્ટિંગમાં તમને 2 લો ડોઝની દવા આપે. For instance, if ramipril start kare, say 1.25 milligram, then I might even give you 5 milligrams of amlodipine at the same time, because there's itla fine research kera che. I was on a talk about a month ago, and evidence batade che ki tame 2 blood pressure ni dawa khavo the more blood pressure will come better controlled and quicker blood pressure control rather than increasing the dose aste vadare, and it's dangerous. And તમે ડોક્ટર પાસે 4 વીકે જાઓ અને બ્લડ પ્રેશર વધારે, બ્લડ પ્રેશરની ટેબ્લેટ્સ વધારે પાછી આ કરશે તે કરશે, એટલે તમે ડોક્ટરમાં એક કોન્ફિડન્સ જતો રહેશે. સો ધ ન્યૂ રેગ્યુલેશન વિચ અમે આ કરે એ બે તમને દવા આપીએ, આજે બ્લડ પ્રેશર ડાયગ્નોઝ કરે તો બે લો ડોઝના આપીએ instead of giving high dose tablets of one. Yeah, so 2 tablets are better than 1. And the same thing is sure for diabetes. તમે diabetes હોય, it's better to have 2 tablets at the start, metformin and something called dapagliflozin and empagliflozin, because they are better for the kidney and heart. So anyone who comes to me and they get diagnosed tomorrow with diabetes or blood pressure, for both of the conditions, I'll give 2 tablets, not 1, and explain to you why I'm giving it to you. All right? So 2 tablets are better than 1. Now, જે blood pressure ની ટેબ્લેટ તમે ખાઓ, બીજી દવા ખાઈ શકો તમે, પણ આ દવા તમે ibuprofen એટલે Nurofen, diclofenac, which is the other name for diclofenac. It'll come to me in a minute. Naproxen, અને તમે ઘૂંટામાં ડોક્ટર આપશે તમને કે ઘૂંટામાં દુખે છે તો તમને આઇબ્યુજેલ આપશે અને ડાઇક્લોફેનિક જેલ આપશે. આઇબ્યુજેલ is the same as ibuprofen. તમે ઘસો એ તમારી blood stream માં જાય. All of these drugs can cause kidney damage, and that can interfere with the blood pressure treatment. So, all right, તમને માથું દુખતું હોય, could be other reasons, અને તમે ibuprofen ખાઓ કાઉન્ટર ઉપરથી કે ટેસ્કોમાંથી કે સેન્સરીઝમાંથી, be careful, because that can affect the blood pressure treatment and affect your kidneys as well. All right. So it's not as simple as giving you 1 tablet. You can take anything you like, which you can buy over the counter. Right. Now, diabetes.
Harish, just another question.
Yeah.
Is if Daraben can come off mute and just ask the question? I don't quite understand, but I think there's a question.
Yeah, go on. Yeah, feel free. Hello.
Hello, Daraben.
What is dapagliflozin for?
Right. Dapagliflozin is a drug that's called an SGLT2 inhibitor. Okay. I won't go to the full name of it. SGLT2. Now, the dapagliflozin is a tablet, and it has showed quite categorically in the last 5-10 years that when you start that with diabetes treatment, it protects your kidney from failing, and it protects your heart from failing. Now, a dapagliflozin no license મળ્યું છે આ countryમાં કે માણસને heart failure થાય, પણ diabetes ના હોય, so we also give dapagliflozin for heart. Okay. The way it works for my body, okay, I'm coming to the side effect, is that it makes you push the sugar out. Now, તમે sugar કાઢ નાખો પિશાબમાં અને તમને લાગશે કે પિશાબમાં ઇન્ફેક્શન થાય, or નીચે તમારી groinમાં angle of the legs એમાં infection થાય, then you have to tell the doctor. Okay, that's the first problem. So because it pushes the sugar out, and if there's sugar on the skin, all right, because as we get older, we have a bit of leakage of urine, there's a risk of infection and thrush in the corners. All right. So there's the first risk is urine infection and other infections. All right. So the GP should tell you that's how dapagliflozin and empagliflozin works. The second but more serious side effect is when તમને diabetes હોય અને dapagliflozin કે empagliflozin આપે દવા, તમને ઉલટી થાય, diarrhea થાય, પણ તમે sugar check કરો તમારો normal હશે. Now, એ દવા તમારો sugar level is normal, પણ તમારી પિશાબમાં fat બરે ત્યારે ketones નીકળે, ketones. એ ketones વધી જાય, dapagliflozin, empagliflozin ખાઓ ત્યારે, then the treatment has to be through the hospital. We can, as GPs, I can stop the tablet, but sometimes that means that તમારે dehydration થાય છે, and you need some fluid for 24-48 hours. So on the positive side, the drug is very good કે તમને long term you won't get kidney failure, you won't get heart failure, all right? The risk is reduced, and it will protect the kidneys and the heart. But there are side effects of the gliflozin, the SGLT2 inhibitors. Yeah. Does it answer your question, Ben?
How long do you have to take this tablet?
Which one?
This
The one
dapa.
And I'm going to give you bad news now. Forever.
Forever.
because તમને અત્યારે નોર્થિક પાર્ક હોસ્પિટલમાં હેરોમાં કિડની વોર્ડ ઉપર લઈ જાઉં તમને. All right, 80% of the people having dialysis are Indian, and 80% of those people will be diabetic. So વિચાર કરો, it's a big problem in northwest London. But with this tablet, we will reduce the people having dialysis, because dialysis, it means that you have to go to the hospital 3 times a day and they clean your blood 3 times a week. Sorry, not 3 times a day, 3 times a week. If you travel abroad, you can take the machine abroad. They can lend you one, or you can book with, one of the big hospitals, Bombay or big town. But how can you go to India and be having 3 days? But it makes you, once you start the dialysis, anyone આજે તમે કહેજો મને કે 4 કલાક સુધી dialysis કરશે પણ આખો દિવસ જતો રહેશે, એટલો ઠાક લાગશે તમને, because they clean the blood. So the question is that how long do we keep on dapagliflozin? For life. Okay, unless you get an allergy or side effect from it. Okay, now
I used to take tablet.
Bisoprolol.
Yeah. Then I had to stop. My pulse was going down.
Yeah.
Went down to 44, 46, 47.
Yeah.
One of the doctor told me to keep an eye on it. It shouldn't go more less than 60.
Yeah, 55 is my limit. Yeah, 55. Yeah. Depends on the doctor's confidence as well. Yeah.
55, when he went to 55,
yeah,
I went to see a doctor. Doctor said you shouldn't be worried about it.
Yeah. So that depends also on the dose of bisoprolol, because bisoprolol comes in 1.25, 2.5, 5, and 10. Okay, so તમે 5 milligrams the tablet leta hoy bisoprolol and your pulse is going to 50, say, then the doctor might say, yeah, it's a good drug and it's good for the heart. I'll lower it to 1.25. Okay, so there's a balance. All right, now if on 1.25 your pulse is getting less than 50, then we've got a bit of a trouble there. All right, then we have to stop it.
He went to 46, 47.
Yeah.
Then they say you stop it.
Yeah, they would, but it depends on the dose. What dose were you taking?
Oh, I can't remember now.
Yeah, it won't be 1.25, because the thing about it is that your blood pressure, all drugs or beta blockers, and a pulse gets less than 55, that means when you're exercising, your pulse should go up. But this tablet, the beta blockers keep your pulse down. So that's not good for you. Yeah, because after exercise, in a pulse. Now, if it becomes less than 55 in my books, then I would either reduce the dose. Yeah.
1.25 milligram.
Milligram. So that's the lowest. That's the lowest dose.
Yeah, but that's why they stopped it, because it went down to 46, 47.
No, I understand, but it all depends on your other conditions, like whether you got heart failure, blood pressure, diabetes, everything else, and what the dose of the drug was. That's really important. But you see, if someone comes to me and say, look, doctor, I'm taking 5 milligrams of bisoprolol, my pulse is down to 50, I'll say, that's okay. Let's try 2.5. He comes back again in 2 weeks, my pulse is still 50. I might try 1.25. If the pulse is still 50 on 1.25, then I might stop it. But it's a beta. When I was a student in the late 70s, we did not think of giving beta blockers for heart failure. Okay, that was a no-go area. It's like a red flag. But now beta blockers are good for heart failure. It's a standard treatment. A lot of doctors are scared, right? Because they think, oh, it'll give you asthma, it'll give you this, it'll give you that. Actually, there's nothing to be worried about. As long as the doctor monitors you, all right, and there's no effect at all. In my experience, how many times have I stopped beta blockers, say, in the last 37 years as a GP? Maybe 2 or 3 times, okay, because they got side effect. It's extremely rare, extremely rare. Now, the thing is, sometimes the doctor will say to you, oh, bhai, dhyan rakjo tame, swas chade, pulse oshi thai jaye, ta band karwa padse. They'll frighten you. Upparthi frighten kar nakhse tamne. All I'm saying to you that you have to follow the instructions, but don't get frightened. Take it easy. It's unlikely you're going to have big side effects. All right? But If the beta blocker is causing low blood pressure and low pulse, I'll tell you what a low blood pressure is in a minute, and you're having fainting, then we may have to stop, because that means the blood pressure tablet is too strong for you, and we have to raise your blood pressure. Okay.
Thank you.
Thank you.
Okay. Now,
Harish, there's one more question. If
yeah,
you don't
go on,
mind.
fire. This is much better when we talk about.
I have noticed that after being prescribed amlodipine, my memory. Amlodipine, sorry, I can't pronounce it.
Yeah.
My memory is getting worse. Is this also a side effect? I also have to take Ramipril.
Yeah, right. Number one, it's not a side effect itself. All right. So it depends, first of all, on your age. And if your memory is getting worse, you need to see the doctor, and they'll ask you simple questions. First of all, there's a simple 10-point question like, what's the day today? What's the date? What's the name of the Queen? What's the name of the Prime Minister? What's your address? What's your postcode? What's your telephone number? Can you count from 10 down to 1? And that's a mini mental test score, right? Out of 10. There's a more complex test, which is out of 30. And there's also another test called MOCA, M-O-C-A test, the Montreal cognitive ability test, all right? And then drawing karave, there's things like a hippo. You have to draw a clock. And the doctor has to do that. It takes a little bit more than 10 minutes, all right? So it doesn't happen in 10 minutes. And if that shows that your memory is going down, okay, there are numbers, then he may have to refer you for further investigation of that memory. In my experience, it's unlikely amlodipine and Ramipril causes big memory defect, all right? So depending on what's going on, the more important factors in memory, probably a lot of people is, for us Indians, is people are vegetarian, so their iron level might be low, all right? Number 2, they might be low in vitamin B12. Number 3, they may be low in vitamin D. All of those things can affect your memory. So if you have memory problems, don't point it straight to the tablets. Think of other reasons. And the last thing that can reduce your memory is something called the thyroid. Thyroid gland. All right. But you can only find that out from doing a blood test. All right. So if your memory is not good, let your doctor do the test and say, look, my memory is not good. I need a blood test for thyroid, vitamin D, B12, and iron level. If that's okay, then have a full memory test and do something else. All right. But it's unlikely the tablets. Okay. Keshoba, is that right?
Yeah, thank you. Thank you.
Right. So if you've got diabetes and blood pressure, all right, a lot of people will have that in the group today, then your blood pressure really should not be over 130 upana figure or 80 at the bottom. All right. Why is that? Now, except for the over 80s, all right, I'll come to the over 80s in a minute. Because if the blood pressure stays high, the diabetes will damage your kidney. And I've told you already, the blood pressure will damage your kidney. To protect the kidney in diabetes, the dapagliflozin or empagliflozin will protect you. Also, controlling the blood pressure will control the kidney damage. So the target for people with diabetes should be near enough 130 over 80. Anything higher on a regular basis, blood pressure, then see the GP. Say, look, my blood pressure is not controlled, so he may add another tablet on. He may increase the dose. He may change this. He may change that. He will check your kidney test. He will check your urine. Because urine malu ACR nahi apne baat keri. If in a 30 units that means the kidneys are getting damaged, and you don't want to be having dialysis, and you don't want kidney failure. Okay, so 130/80 for diabetes. Now, if you have blood pressure and kidney damage, now the kidney damage could be due to problems because you've taken some drugs, like very strong drugs which rheumatology doctors give you, methotrexate and things like that. They may have given you too much ibuprofen, diclofenac, naproxen, painkillers over the years. All right. In the old days, GPs weren't controlled that. We used to say, 3 months tablet, 3 months tablet. And those tablets can actually damage your kidney to a certain extent that together with the blood pressure, they'll damage the kidney more. So as I just said, you need to lower the blood pressure 130/80 or lower. That's the figure you need to have in your mind. That's the aim. So most people People who haven't got any problems, normal age group, your blood pressure should be no greater than 135/80 on a day-to-day basis. All right. Now, I'll come back to it in a minute. Then we have to measure it again. Maybe even do the ABPF or the 24 kalat measurement or home blood pressure monitoring. Okay. And then find out whether you need blood pressure on a balance of probability on the average 24-hour blood pressure. Is your blood pressure high throughout the 24 hours or low throughout the 24 hours? All right. If it's more than 50, you'll need blood pressure. If it's less than 50, high blood pressure, then you won't need treatment. And we can repeat the test again in a year or two's time. For the over 80s, now, people who are older, more than 80 years old, I'm very careful with them, all right? My blood pressure target is individually targeted for each person, all right? There's no hard and fast rule, because I've seen in my life as a doctor, when you lower the blood pressure for the over 80s people, all right? And if it goes too low, they'll fall down, they'll faint, because as you get older, my arteries are brain ma heart ni jam is heart thi jai, and the arteries heart thi jai, you need a bit of blood pressure to get the blood going through the brain. Blood pressure bo chuka so the chakkar aase, all right, jaka lekha se, and 80 of the over it padi jao, and if they break the hips ke hadka bhange, it is unlikely and they have to stay in a home or khatla, all right, and the walking is very, very difficult after 80 years old. So my target for a blood pressure is to monitor them, see how weak they are. Weakness and general frailty. Bed mathi utre che, chair mathi nikde che, ketlu chali sako che, gaji upar niche chadi sake, loka toilet ma ekla jai sake, lakdi thi chade, trolley lei che, tripod lei che. So each individual person over the age of 80, and if blood pressure hoy, so we have to assess them. All right. And those are the people we usually give the mild tablet like bendrofluozide, right? 2.5 milligrams, the water tablet. All right. So we have to be very careful with the over 80s. Now, pregnant ladies or planning for pregnancy. All right. So if you got young people, our drugs, pregnancy it's okay. Anything that begins with RIL, PRIL, like ramipril, enalapril, lisinopril, any drugs that end in sartan, losartan, valsartan, irbesartan, because if you have a pregnancy, then the baby's spinal cord, the spina bifida, spinal cord, or in some cases, a brain no scalp. So the chances are the baby, when it's born, will be brain damaged or back damaged and may even die very quickly. So pregnant ladies can't take those drugs which I've talked about earlier, which everyone else can. All right. So if you have blood pressure, don't worry too much about it. It's easily treatable by the GP. There are side effects to the tablets. There are reasons we give you medications, but we also ask you to have, in partnership with the GP, lose your weight a little bit if you're overweight. Reduce salt intake. Stop smoking. Reduce alcohol intake. Look at your diet. And a little bit of exercise, 10, 15 minutes of exercise a day. You don't have to walk 10,000 steps, okay? And that should help you, all right? Okay, thank you. Any questions?
Harish, there's a couple of questions here that was I able to ask.
Yeah,
I think this one you covered already, but maybe you want anything else to add. Low blood pressure with no medication, is that a bad thing? Bad long term if untreated? What can you do yourself to correct low blood pressure?
It depends how low it is. All right, that's the first thing. All right. Let's just take this off screen. Sorry. So if your blood pressure is so low, okay, something like, say, especially Asian ladies, they're very slim, very thin, young ladies, and then blood pressure might be 90/60. And if they stand up, you see, so what I haven't mentioned is blood pressure and then I get them to stand up for 1 minute and then take the blood pressure. Okay. Now, તમે 1 minute સુધી ઊભા રહો અને blood pressure ઓછું થાય, that's dangerous. Okay, it's maybe lower by 10 or 20, 15 to 20 millimeters in each of those, a big blood pressure and a smaller blood pressure. That is dangerous, all right? Now, if that's happening, then we have to do more tests to see, have they got another medical condition that's giving them that? Or is it because they've just got a low blood pressure, all right? Now, Germany, if you're in Germany, they treat all the low blood pressure with a drug. Here, we only treat if you're symptomatic and when you stand up and your blood pressure falls down, all right? So if someone is on a blood pressure tablet and he comes to see me or she comes to see me, I do both the blood pressure sitting and standing after they stood about nearly a minute. And if the blood pressure falls too much, then I'd be worried, all right? Then I'd be worried. Now, is there treatment for it? There is, all right? Now, I just had a problem with Northwick Park Hospital because a patient went there recently and when I was doing a locum in Wembley and the blood pressure was very low. The patient has, Indian, lots of medical conditions. And they wrote me a letter and said, doctor, give him this drug. So Dr. Mistry writes a letter to the consultant. I said, this is a serious problem. This is not a job for the GP. There's a medicine called fludrocortisone. It's a steroid drug, not the steroid where you build up the muscles, but it's a different type of steroid which controls your blood pressure to a normal level. And I said, the patient has to be admitted to the hospital for 2 or 3 days. You start the tablets, you sort out the dose, and I will monitor them in community. They admitted the patient for 4 days and got it right, and then the patient came out. So there is medication for very low blood pressure. Normally, lowish blood pressure is pretty good for you. All right. I mean, I don't take blood pressure tablets. My blood pressure is about 125/80. All right. But I do find that sometimes if I'm in the garden, I stand up suddenly, I will feel a bit dizzy. All right. It's because when you bend down, the blood pools in the legs, the blood it collects in the leg. But when you suddenly stand up, the blood pressure falls. So मानस તમે રાતના પિશાબ કરવા માટે ઉઠો, alright, તો પિશાબ કરવા જાઓ તો ફર્સ્ટ થિંગ તમારે કરવા પડે કે ખાટલામાં બેસો, alright, પગ નીચે મૂકો, પછી આસ્તેથી ઊભા થાઓ અને પિશાબ કરો. તમે રાતના પુરુષો sit down on the toilet seat and do it rather than standing up, because તમે પુશ કરશો પિશાબનું રાતના તો blood pressure ઓછું થઈ જશે અને પછી ચક્કર આવશે અને પડી જશો. અને ટોયલેટની સીટ તમને લાગશે માથામાં, ટોયલેટની basin, you'll be in trouble. You'll end up in hospital. So just take everything slowly, and that's okay. Yeah. So there is low blood pressure, which needs treatment, but it needs to be diagnosed. And we call it postural, posture, standing up, hypotension, low blood pressure. And that can be quite serious. And especially in the elderly, when we give blood pressure over 80s, that's what I'm worried about. And that's why I don't lower the blood pressure too much, because they need a force of pressure to keep going. Yeah. Does that answer your question?
Good. Another one, Harish bhai.
Yeah, go.
I was on high cholesterol tablets, high blood pressure tablets, and diabetes tablets. Through lifestyle changes, exercise, regime, and dieting over 2 years under locum doctor's supervision, I have now stopped taking all tablets, including Ramapil. Now new doctor wants me to take high cholesterol tablets to reduce level under 3 from 5. All my measurements are within limits of your slides. Please advise.
It depends. Now, cholesterol tablets, all right? So cholesterol tablets are given. Let's stick to one tablet at a time. If you had a heart attack and if you got diabetes, all right, a heart attack, a diabetes, then you must never come off the cholesterol tablet, all right? Because there are 2 or 3 reasons why. Okay, the first reason is because you had diabetes, you are going to be at high risk of getting a heart attack. Number 1. All right. Now, what the cholesterol tablet is, I don't know, can you see this? Supposing this is your artery. All right. Okay, this is open artery like this. Yeah. Cholesterol gets deposition there, and the artery closes up, and then you have a heart attack. The other function of the cholesterol tablet is what happens is when you have the cholesterol deposition, it's not the best thing, I'll just show you. This is your artery, right? So the cholesterol is deposited here, so it becomes smaller, and then you have a heart attack. All right. When the cholesterol is deposited in here, this lining of the artery becomes weak. So the pressure your pressure will open the artery, break the artery, and it will close up. So the cholesterol tablet has two functions. Okay, GPs won't tell you that. One is to lower the cholesterol by measuring, which you measure in the blood. The other is to protect the lining of the artery. So if you have diabetes or heart disease, it's very, very important you control the cholesterol. The cholesterol and strokes story is not so clear, but from experience, we know that if someone's had a stroke and they've got a cholesterol is high, we will reduce it. So again, if you've had a stroke and minor stroke or major stroke, the TIA stroke and heart attack and kidney disease, you should never come off, right? Now, if you just have a family history, say, for instance, and your cholesterol level is 4.9, which is the upper limit, all right, total cholesterol. Because when we measure cholesterol, there are 4 or 5 things we measure, all right? So the total cholesterol is 4.9 is a higher limit. Now, if there is a family history, we want to reduce that cholesterol, even kidney disease, even if you haven't got diabetes, even if you haven't got blood pressure, by 1 point. So if it's 4.9, with the family history, we have to bring that cholesterol down to 3.9. Okay, that's the first thing. The last bit of the cholesterol, there's good cholesterol and bad cholesterol. Something called HDL cholesterol is good cholesterol. It should be more than 1. But the non-HDL cholesterol, which is everything else that will damage your heart, all right, has to be less than 3.9. Ideally, if you've got blood pressure or if you've got heart attacks and things, that should be less than 2, all right? So when the locum or other doctor has reduced your blood pressure, the thing is, they know your history, all right? I don't know your history, the full history, your family history. That's where it all comes from, right? But you need to sit down and discuss it with the doctor and say, look, I don't think I want to take the cholesterol tablet. And the doctor will say, look, I'll put your risk in this calculator. Your risk of having a heart attack or whatever in 10 years is this, something we call Q risk, all right? And if it's more than or near enough 10%, then you will be discussing with the doctor to take the cholesterol tablet to do two things. One is to reduce the cholesterol level to stop the artery furring up and closing down. And the other is to protect the lining of the artery. It's called a pleiotropic effect, all right, to strengthen the artery. So that could be the reason. I mean, but there are many reasons why the doctors would discuss that. But your GP will know your medical history. But ultimately, if you don't want to take a tablet, it's your choice. We can only advise.
Okay, thank you, Harish. Right. Next one is there any lower limit for blood pressure than the 130/80? And is that good or not?
130 or 80 is a good blood pressure, all right? So if you have some other disease like heart disease, the lower the better. But nothing as low as 90/60 when you stand up and you get postural hypotension, not hypertension, hypo, and makes you feel faint or dizzy. That's dangerous. So we have to keep it what is good for you, depending on your age and your lifestyle. Okay.
Harish bhai.
Yeah.
It's Ramesh bhai. I was taking tablets for cholesterol.
Yeah.
And I was getting a body ache.
Yeah.
And I spoke to my doctor and got to change to a different one. And since I've been taking this Avastro-Stein or something there, it's much better than...
Okay. Yeah. Okay. I get that right now. In my experience, I have to tell you the side effects of a statin. These are all statins. There is pravastatin, simvastatin, atorvastatin, and rosuvastatin. All right.
Yeah.
Those are commonly used drugs. All right. They're all statins. But I don't make a big fuss that you get aches and pains. All right. I just mention it because the big fuss I make, the patients will come back in 2 weeks' time. All right. Now, when patients come back in 2 or 3 weeks' time, I tell them to carry on and I'll do a blood test. All right. And there's a blood test measurement called CK, creatine kinase. That's a breakdown of the muscle. All right. And if that is raised, all right, if that is raised, I will seriously think of stopping the statin because you have aches and pains anyway. All right. I'm not saying that statins didn't do it to you, but you have aches and pains anyway. But if I mention that you're going to get aches and pains, I can tell you, you will be back to see me in 3 weeks' time, all right? So when I give that, I've only had 2, when I was a doctor in Kenton, in Harrow, I had 2 really abnormal blood tests. You know, the blood test should have been about 30. And both these people, their blood test went up to 1,500 within 2 or 3 weeks. They came in with their muscles aching and this. And those are the only 2 people I had to stop the statin. But you're right. These are sister compounds: pravastatin, simvastatin, atorvastatin, and rosuvastatin. Rosuvastatin is the strongest in a way, all right? And it's usually used for Asians with hypercholesterolemia in the family, all right? High cholesterol in the family. But it's okay. They're all sisters. You can use them, all right? So it's not a problem. It's not a problem. Now, someone's just put a question of Lipitor. I think that's what you're saying. Atorvastatin is the same as Lipitor, all right? Okay. In the old days, you could buy simvastatin, but 10 milligrams over the counter. A lot of my colleagues and doctors, we all used to take it over the counter because of family history and whatever. But you can get them from your GPs now, all right? So that's why your GP, they must have changed from simvastatin to atorvastatin. I give mainly atorvastatin. It's good for diabetes, all right? It's a good drug. Now, I start sometimes on 20 or 40 milligrams. Now, if you had a heart attack, all right, you will be on nothing less than 80 milligrams of atorvastatin, 80. That's what you need to take to keep the cholesterol down. Yeah, got it? So again, the doctors will have the blood test, right? I mean, there are 2 other blood test results. One is, if your doctor does it, is the ratio of the total cholesterol with HDL, which should be less than 4. Your bad cholesterol, non-HDL cholesterol, should be less than 3.9. So if you do the NHS app, it'll be on there. So if you haven't joined the NHS app, all right, just go into Google, get NHS app, and you can see the blood results. My wife had a blood test this morning at the hospital. It's already at home here. Doesn't have to call the GP to find out the result. I can see it here. All right. So get onto the NHS app. And maybe one day we should do the numbers of the blood test, what you should be looking for, because it's really important that you know the numbers for yourself, all right? But, you know, the lower the cholesterol is better. Lower the cholesterol is better. Okay. Any other questions, Kishore?
Sorry, Harish, there's another one here. Is there any lower limit for blood pressure than 130? I think we talked about that one already. I think.
Yeah.
If your arms are painful, would your blood pressure shoot up?
Any pain in the body, headache, will shoot your blood pressure up. Right. So when we talk about, say, people with rheumatoid arthritis or bowel disease, such as Crohn's disease, also, or cancer, all of those people are at risk of getting high blood pressure and diseases related to the high blood pressure. All right. So all of them are so we have to control them. All right. So if you've got rheumatoid arthritis, it is my responsibility to check your cholesterol, my response to check your blood pressure to reduce that. Now, if you're in pain, your blood pressure will go up, yes. But we have to try and make sure that we control the pain by medications such as paracetamol or something else, or maybe even ibuprofen, you know, make sure your kidneys are not damaged, and then measure the blood pressure. Geeta Ben, no. You can't take the blood pressure in your ankle. Now, supposing someone has amputations, you know, because they've had septicemia or problem, there may be other ways to take the blood pressure, and maybe a blood pressure in the ankle. But on a route, if you've got all your limbs, all 4 limbs, I don't advise you to take a blood pressure in the legs. Any other question, Kishore?
Okay, so another one here is Deepak. Sorry, is do the at the evenings, does the blood pressure go up?
It shouldn't. When you're relaxing, it should come down. But don't forget, when people say their blood pressure is going up at evening, don't forget they may be watching television, there might be a scary program, they might be watching the news. You know, there's nothing happy about the news these days. I'm sorry to bring you bad news. You know, we've got the Ukraine war, we've got everything going on in the Middle East. There's a risk of a world war at the moment. So when I watch the news, my blood pressure will go up. So it shouldn't. And then don't forget, people have their own personal family problems, their marital problems, their children's problems. This boy has run off with this girl, and that boy has run off this. Oh, this is not happening. They're arguing the children. They can't afford the mortgage. They can't do this. They can't do that. So there are many problems why your blood pressure at home might go up. All right. So, you know, if you have worries like that, the doctor can refer you for counseling and things. It's very easy. They give you a number, you ring them up, and they will call you back. All right, so you don't have to give big details. Any other question?
Yes. Is it true that you cannot take Lemsip when taking heart and BP medication?
Right, good question. Lemsip has all sorts of medication. I'd have to look it up. All right. There are certain acids in it which can affect your blood pressure. All right. But you know, the doses are very small. It depends how much Lemsip you take. All right. Because a lot of these companies, drug companies, will cover themselves. They'll say, if someone has got this, I don't want to be sued. All right. But if you take Lemsip 6 or 7 times a day above the dose, that may be a problem. But if it's just a normal dose, I don't think it's a big issue. Now, what is a problem with blood pressure medication, heart and thing, is a fruit called grapefruit. All right. Now, you remember the ECG people have, you know, now there are certain numbers on that. If you take a grapefruit with heart disease and certain drugs, you're likely to get an irregular rhythm of the heart. So if you're taking heart medication, you mustn't eat grapefruit juice, grapefruit or grapefruit juice.
Okay, thank you. So what do you think of herbal medications for controlling blood pressure? There seem to be a lot advertised and also claiming to be Ayurvedic.
Yeah, great. I mean, I'm not trained in herbal medicine. I mean, I went to my village in India in Matwad. They had a GP there, and I went into her office one day, and I said, "Where'd you keep your medicine?" She opened the drawer, and I said, "Oh, these are all herbal medicine." She said she's got MBBS homeopathy, not a conventional MBBS I got in conventional medicine. Look, if it makes you happy, do it. But there is no evidence that herbal medicine for whatever disease or whatever will cure you. What is true is that gourd, Gourd, or Karela. Now, you can get Karela juice and things. There are chemicals in Karela that reduce your blood sugar. Now, if you take diabetes tablets and Karela, your sugar can get so low you can pass out. And if you like Karela is a really horrible tasting, bitter tasting stuff. All right. So I know that because we've had people in hospital coming in because they drink Karela juice and they take tablets and the sugar gets so low, they faint. All right. So you have to monitor your sugar. And if you're on tablets, the GP is unlikely to prescribe you the blood testing kit. All right. Because blood testing kits are expensive, and the only people who get it really in England are people who are on insulin, all right? Because they have to measure it 3 or 4 times a day. But there is a company, can't remember the name, but the actual equipment is called Libre, Libre 2. And they will give you a 3 months trial where you put this thing on, you go onto your phone, and you can continually monitor your sugar level. So you might want to try that. I can't remember the name. I'm not sure if it's Lily or someone, but if you Google Libre 2, they'll give you a 3-month supply. But it's unlikely your GP will continue to prescribe that because the actual monitor is very expensive.
Another one here. If your pressure is about 150/90 and on amiodarone 5 milligrams, I'm 66 years old. Should my dose be increased?
Right, really good question. So you're 66-year-old, same age as me. 150/90 is too high, the blood pressure, right? What I would ask your GP to do is to give you one of the prils, possibly 2.5 or 5 milligrams of ramipril, okay? Why do I do that? Because the European Society of Cardiology and the American Cardiac Association have now told that you should be on 2 tablets, all right? You're only 66, only 66. I think I'm quite young. You know, I still feel like a teenager, 66. Your blood pressure should not be more than 140/80 odd. All right. So 150/90 is a little bit too high. All right. A little bit too high. No panic stations, but it needs to be controlled better. All right. It needs to be controlled better. I wouldn't increase the amlodipine to 10 milligrams purely because of the side effect I told you earlier. Your ankles in the hot weather will swell up. If you go from here to India in a 10-hour flight, your ankles will be like this, fat, all right? And then you'll see a doctor who will do blood tests for heart failure, blood tests for this, and faff around. 10 milligrams of amlodipine, in my experience, causes more side effects than other blood pressure tablets. So 5 milligrams is fine, but add another blood pressure. They may even want to add on something like metoprolol or bisoprolol, but I would go for ramipril because it will protect your kidneys. Okay.
Okay, good. We talked about the one about the ankles. So how do doctors decide whether to give prilolol tablet? Is that right?
Oh, bisoprolol.
Yeah, it's not really sacred. Yeah, because
Yeah. Right. So so we talked about blood pressure. Now I haven't really spoken to you about the dangerous blood pressure. So if someone comes to me, say at 6 o'clock this evening, all right, they've got no symptoms, I measure the blood pressure 2 or 3 times and say their blood pressure is say 180 over 110, 120, a high blood pressure, all right. I might check the urine and just to make sure there's no blood or urine in the surgery. But I'm worried because if the blood pressure is that high, I might be worried that something might happen to them in the night. Plus, I don't know how long their blood pressure will be that high at home. All right, it might not just be. I measured it 2 or 3 times. The blood pressure is say 180 over 120. To bring that blood pressure down quickly, I might give them bisoprolol 5 milligrams. All right, so it's a judgment and the skills of the doctor that will decide which tablet to give you. I have in the past, for not such a high blood pressure, but slightly lower blood pressure, given amlodipine, and see them the next day or the day after if they've got a blood pressure machine. And like that, I can monitor it. So it's real, but bisoprolol is a very good drug because the way it works, it reduces your heart pumping, all right? And it reduces the pressure within the heart, which is where the damage is caused, all right? So, and it works very quickly. So my preference for a really high blood pressure needs treatment immediately would be that high. So now there are 3 different types of blood pressure stages, right? There's stage 1, stage 2, and stage 3. Stage 3 is a persistently high blood pressure. Persistent means it's always high, more than 180 over 120. And it can be quite severe. And if I check the urine in the surgery, this is not the ACR, I just do the dipstick. And if there is protein, to me, that's an emergency. I need to treat that blood pressure very high. If they've got symptoms like chest pains or shortness of breath or severe headache, I might refer them to the hospital, all right? Stage 1 blood pressure is between 140 over 80 or 90 to 150 over 100, all right? That's stage 1. Stage 2 blood pressure is 160 over, I would say, about 90 to 100. So there's stages in blood pressure. Once I decide which stage you're in, I will also check the rest of the body, like your eyes, your kidneys, your cholesterol, everything else, all right? I'll check your salt intake, I'll check your weight, I'll check your blood pressure, and then advise you, all right? So really blood pressure is very rare. In my lifetime, I've probably, as a doctor for 43 and a half years, I've probably seen 1 or 2 emergencies of blood pressure. It's extremely rare, all right, what we see in surgery. I'm not saying it doesn't happen when people collapse at home and they've got other conditions. That may also happen, but it's very rare in the surgery for me to see high blood pressure, all right? So there are different grades. So ideally, you need to keep your blood pressure below 145, 85, all right? And finer if you've got other conditions like kidney damage, diabetes, or whatever. But you shouldn't be all the time greater than 180 over 120. Now, having said that, if you remember those slides, I said the type of cuff you have to use, all right? If you use a cuff that's too small and your arm is a little bit fat, it will give you the wrong blood pressure. You will get the wrong treatment for it, all right? So it's important, if you're not sure if you've got the right cuff, take the cuff to the doctor and say, doctor, is this the right cuff for me to use for this blood pressure in my arm? And they'll tell you. Nurses can tell you, nurse practitioners can tell you, all right? So do that, please.
Okay, there's a couple of questions, people with their hands up, so let me set it on the chat. Can I ask Bina and Jazz Mistry to ask their question?
Yeah, hello, doctor.
Hi.
Hi. Aspirin. I hear that states and Canada, the people are given aspirin after the age of 40, 45. Because of the heart condition and blood pressure condition. Why is it not given here in England?
All right. Right. Aspirin is very contentious. All right. So there's something called primary prevention. That means you've never had a heart attack. You've never had any other conditions. If you take aspirin, the risk of you bleeding from the stomach, because aspirin can give you stomach ulcers, and if you take it with Nurofen, your risk is even higher. So if you take aspirin, your risk of having a peptic ulcer, acid ulcer from aspirin is higher. You'll bleed a lot, and your risk of dying from that, because if you got a perforation, a hole right through the stomach, what that would mean that you would need about 20 or 30 pints of blood transfused. So in this country, primary prevention is out. All right. We no longer, if you ask me what I did about 30 years ago, well, I was taking aspirin, because you buy those 75 milligram aspirin from the chemist. 100 tablets cost £1. Okay. So we all used to do that. Now, in America, they've been taking aspirin, but they're also changing now. All right. Primary prevention aspirin is no longer indicated. Now, if someone's had a heart attack, they will be on aspirin for life. All right. That's a different matter, because they've had damage to the heart. All right. If they're allergic to aspirin or they've had a side effect, there'll be another drug called clopidogrel, also 75 milligrams, and they'll also be on it for life. Now, if you had a minor stroke, a transient ischemic attack, TIA, that means the stroke symptoms clear within 24 hours. You're back to normal in 24 hours. In those people, what happens is for the first 2 weeks, we give 300 milligrams of aspirin, which is a normal tablet of aspirin. The baby aspirin, 75, which is for primary prevention, which we no longer give. So if you're on aspirin for no reason, I would suggest you stop it, because it will cause you a stomach ulcer and you'll be in big trouble. All right. So if you had a stroke, minor stroke, transient ischemic attack, TIA, you need to be on 300 milligrams of aspirin for 2 weeks. All right. That's the national rules. After that, you would put on 75 milligrams of clopidogrel for life, which is a different antiplatelet drug. Okay. So that's why we don't give it here. All right. So if you ask me, do I take aspirin 75? No, I don't. I used to when I was about 40 and 50. I used to, but I have stopped many, many years ago.
Sure. Thank you. I've got another question as well, Doctor. Sorry, whilst I'm here.
That's all right.
I have no blood pressure. I have no cholesterol or diabetes. But when I'm in the hot country, my ankles swell up.
Okay.
What should I do with that?
That's a different matter. Best thing is to send me the ticket and I'll go to the hot country, because this is miserable weather. I'll give you my address in Pinner. Just send the ticket.
Okay.
The thing is, right, so in a hot climate, you've got no blood pressure, no diabetes, no kidney problem. There are 2 or 3 things. Number one, you must drink fluids to hydrate yourself. All right. Now, in the hot, it's some people, like everyone, ankles and blood vessels are different. In a hot climate, all right, everything swells up and the blood doesn't come back to the rest of the body. And that's why you get swelling. The best treatment for that is to put your feet up above your bottom, like this, higher than your bottom, right? And when you're in the hotel or wherever, put it high up if you can, and it'll come down. So you will start the morning with no swelling, but as the day goes on, you're walking, the swelling will go up. It doesn't need water tablets. It doesn't need any treatment. It's just the peculiarity of our body and the heat. All right. I know when we travel long distance, my wife and I, that your shoes start feeling tight, and if you take your shoes off in the plane on a long flight, you'll have difficulty putting them on, because the same thing happens in a flight. Our legs swell up a little bit. That's correct. Yeah, it's very true. We've all had it. But if you want to pass your tickets to me, feel free.
Nah. It's very hard for me to get out of this country. So yeah, I'll leave my tickets to myself. Thank you so much. Thank you.
That's right.
Okay, carry on. There's a bunch of more questions. Are we okay?
Yeah, carry on. I've got the whole evening free.
Okay, no problem. So the next one was, let me just make sure I catch up to the right one. So what should normal sugar level be for over 60s?
Okay, so really good question, because all of us Gujaratis who are in this group today, we eat too much carbohydrates. All right. What do I mean by carbohydrates? I mean things like chapatis, rice, potatoes, all those things got carbohydrate. Pasta, they've got carbohydrates. So when you eat those carbohydrates, your sugar levels will go up. All right. So the best test for diabetes is something called a hemoglobin. That's H capital small b capital A1C, hemoglobin A1C. We should do this talk on numbers. If it's more than 47, then the doctor will repeat that again in 3 to 4 weeks' time. If it's more than 47 again, all right, that means you've got diabetes. Now, what does it measure? Now, if you sort of, I don't know, say for Diwali, you had 2 or 3 mithais, you do a couple of gugras, sukkar pani, everything like that. You've had too much sugar. If you measure your blood test, the sugar level will be high. So in years gone by, we used to measure something called the fasting blood sugar, but we don't do that anymore. It's not necessary. Very few people need to have a fasting blood test. If a doctor asks you to have a fasting sugar test, it's a complete waste of time. All right. So what we measure is your blood sugar in the drug level called hemoglobin A1C, which is the average for the last 90 days. Why 90 days? Because the hemoglobin, the red cells of your blood, you got white cells and red cells. The red cell in your blood lasts for 90 days. All right. So if your sugar level is high, it attaches to the red cells. All right. And we measure the average sugar content for the last 90 days. That's much more accurate than a single level. Because if I've had lots of rice and a couple of mithais, I don't. All right. Earlier today, my sugar level tomorrow morning will be high. All right. That's the first thing. So you want to measure hemoglobin A1C. So ideally, if you're not diabetic, and if you do have the sticks to measure it, your sugar level in the morning should not be more than 7. If it's more than 7, because you used your uncles, your aunts, your mothers, your fathers, your children's sugar level to measure, if it's more than 7, I would get the hemoglobin A1C tested by the GP. The blood sugar, average sugar for the last 90 days, 3 months. That's much more accurate than a single blood test, all right? And that's why people on tablets, we don't recommend you have a daily blood test because it goes up and down, your sugar. And it's not really that accurate. For insulin people on diabetes, people with insulin, it's different because as soon as you take insulin, and if you don't eat within half an hour, your sugar level will go down. And unless your sugar comes up with your diet, you will faint. It's called a hypoglycemic attack. So you must, as soon as you take insulin, you must eat within half an hour. It's a different game. Yeah. Does that answer your question about sugar levels?
Okay, good. Thank you. So next question here is, if you have stage 2 kidney disease, what can you do to help other than control sugar and blood pressure?
Right. Really good question. Really good question. Stage 2 kidney disease has got 5 stages. All right. Okay. And the level 3 stage has got protein in the urine and no protein in the urine. Okay. So depending on, first of all, starting at level 3, if you've got protein in the urine, I would monitor your blood pressure strictly. I would ask you to go and have an ultrasound of the kidneys, right? A sound scan of the kidney. They just do this, the kidneys, and check it. If that's all right, I will check your blood pressure. I will check your cholesterol. I'll check your sugar level and keep your blood pressure in check. And that should keep the progression of kidney disease going, stable. All right. Type 2 kidney disease, it's not serious. All right. It's not serious, but you can't be complacent because to go from type 2, 3, 4, and 5, if you don't control your sugar, blood pressure, cholesterol, diet and exercise, alcohol, and all that, it can progress. But you don't want to go there. So if the doctor has told you that you got the stage 2 kidney disease, I wouldn't panic. What the doctor has to do is to do your blood pressure every 6 months. You might monitor it at home, and maybe blood test once or twice a year. No more than that for all the things I've just told you. So I wouldn't panic too much with the sugar levels, kidney disease type 2.
Okay, Good, thank you. So next one here was repeat on the grapefruit. Why is grapefruit not good if you are on blood pressure or diabetes tablet? Can you just remind the attendees of that?
Right. So go back to your ECG. You know the just have a look. I'll show you. So if you don't know what an ECG is, so there you go. Okay. You know the ECG, electrocardiogram. In the electrocardiogram, there are waves. All right. So it goes like this: P, Q, R, S, T. Okay. If the QT interval is prolonged or can be prolonged because of the changes with the grapefruit juice, your risk of having an irregular heart rhythm and problems related to the heart is greater. So if you're already on blood pressure treatment, that means your heart is under a bit of stress anyway. If you had a heart attack, your heart is under a stress. If you had heart failure, it's under a stress. If you have diabetes, the chances are one day you are going to get something like a heart attack or something like that. All right. So the grapefruit with those medications will interfere the QTC interval. All right. I don't know where my book is, but it's probably in my pile of rubbish here. And that's the issue. That's the issue. But otherwise, people who've got no problem, they can have the grapefruit juice. Now, we talk about irregular heart rhythms. Now, there's something I mentioned earlier on, something called atrial fibrillation. Now, people get it because of heart disease, blood pressure, whatever. But most people who get it are people who are extremely fit, very fit, sporting people who cycle a lot. They get atrial fibrillation, which is instead of your heart rhythm going like this, which is regular, they'll go like this. And that's called atrial fibrillation. And they are people who will be at risk of having heart failure and strokes, all right? But the doctor needs to do an ECG. I mean, every year when I do this to people, every year I pick up about 2 or 3 by just feeling the pulse, and then they have to have an ECG and all the tests they go with it, a scan on the heart, ECGs, maybe even a referral to the hospital, because they need to be on blood thinning tablets for life. All right? Sometimes they give you a little shock to get the heart rhythm back to normal, but that's not done by GPs. And if your GP is doing heart rhythms in surgery, he shouldn't be practicing. He's a quack.
Okay, thank you. Yeah, thank you on that one, Ashray. The next one is similar. Can taking bitter juice daily help reduce sugar levels?
Yeah, bitter juice. You see, we mentioned that. I mean, the one juice I know that helps you is the Kerala juice. You see, if you go to an Indian shop, they do sell it. And I don't know, first of all, how concentrated it is. And I think there's research going on. There's something in the British Medical Journal not so long ago about gourd, Gourd, Kerala. And I think there is research going on actively, both here and in India, whether it'll bring significant sugar down. Because for instance, they can put that sort of whatever the chemicals are in the gourd in tablets, and that can use it like a homeopathic tablets. But if someone is selling it to you, be careful what they're giving you in those tablets. It's not what it seems. They want your money, but you don't know what you're getting, especially on the internet, like this weight-reducing drug, Mounjaro. I know quite a few people I know personally as friends, including a consultant from a hospital who gets it online. But I've also heard that people who've taken online have got fraudulent stuff, and they become very, very sick with the weight-reducing drug they buy over the counter. So be very careful what you can get on the internet. All right. So there's bitter juices and things. Yeah, difficult. There's no great research to show that that can reduce your sugar levels.
Okay. So a comment here from a previous questioner. The reason why I had to make a lifestyle change was because my cholesterol levels remained high, although my dosages were increased. So just a comment that.
Yeah.
That was
okay. So really good question, because sometimes people who take statins, and they get side effects. We said about the knee pain and possibly liver functions becoming abnormal. There are other tablets, all right? The other tablets some people might be on this group may be taking, it's called ezetimibe, all right? It's not a statin, but it works to reduce the cholesterol. It's not as effective as the statins, but they also work, all right? So you need to see your GP. If you're getting too many side effects from statin tablets, there are other cholesterol-reducing drugs, all right? So don't give up. But you know, if your cholesterol is unchecked, it's very high, it will damage you. There's no doubt about it, all right? Okay, thank you.
Okay, if a person had a heart attack, is it worth buying a mobile ECG monitor?
Really good question. Okay. Mobile ECG monitor won't detect a heart attack. Okay. There is one, but you need to be able to read it. All right. It measures your 6-lead ECG. There is a little heart monitor, which is a little silver device, and you put your fingers on it like this. It's called Cardia. That's only good for people who have irregular heart rhythm. Like that, all right? Now, I have an iWatch, all right? And an iWatch, if this will detect my rhythm, all right? But it won't detect a heart attack. People have Fitbits and other devices on their wrist. It does not detect heart attacks. Now, it'll detect irregular heart rhythm. So for a lay person, unless they can read ECGs, I really wouldn't waste your money, all right? I wouldn't really waste it. If you start getting central chest pain, which is very tight, it may go down your arm, may go up your neck, you get sweaty, and it lasts more than 5 minutes, 999. An ambulance or a paramedic will come and will do your ECG, and then they'll decide what to do. Because sometimes it's not clear on an ECG whether you're having a heart attack, but there might be subtle changes, all right? So you may need blood tests to decide whether it's a heart attack or not. So I wouldn't buy, but if you've got irregular heart rhythm and you're tipping into atrial fibrillation out of it, the Cardia device you can buy on Google, I think it's called Kardia. It's about £90. And if you know what to look for, then buy it. Otherwise, I don't think it's worth buying that. Padma.
Okay, another one. Please can you ask my earlier question? If you have a borderline high cholesterol, is it possible to lower it with lifestyle changes to avoid taking tablets in the first place?
Right. So it depends what you mean by borderline. All right. So as I say to you, the total cholesterol should be 4.9 or lower. All right. The HDL cholesterol, the good cholesterol, should be at least 1 or slightly higher. That's a good cholesterol. All right. If you do more exercises, the HDL cholesterol will go up and protect your heart. Then there's the total cholesterol and HDL cholesterol ratio that should be less than 4. If it's higher, something needs to be done. The non-HDL cholesterol is all the bad cholesterol. That includes LDL cholesterol, all right? And that it should be less than 3.9. But we now know that if it's less than 2, even better, the non-cholesterol. So if your cholesterol is borderline, so if someone comes to me, I put them on what we call a risk calculator. It's called a Q risk calculator. It's on my computer at work. Or the one that's the updated one is a Q risk 3, which is on my phone. All right. So I put your details in, who you are, male, female, age, blood pressure, family history, your cholesterol levels, and I press a button. Right. So this is the guidelines here. So if you're more than 10%, we have to have a serious discussion about being on a statin, more than 10. So that means your risk of having a heart attack in 10 years is higher. If your level is 9%, it's a dodgy area. So the last guidance we got on cholesterol, December 2003, said that it's a judgment a doctor has to make after discussion with the patient. So if you've got a family history of people dying suddenly of heart disease under the age of 60, all right, or family members, first-degree relatives, then I would seriously consider you to go on a statin if your level is 8 or 9. Yeah. If it's borderline, then I have a discussion with the patient because I say, take this. The chances are you won't. I'll say, look, why don't you do exercise? Why don't you cut out all the fatty food, cut out all your McDonald's, cut out all the, take out all the fat when you cook your lamb, cut out all the oil. Let's measure the blood pressure in 4 to 6 months' time. If it's come down, great, carry on. I have no problems with that. Your weight might have come down. You've reduced your cholesterol by doing exercise, etc., changing your diet. If everyone did that, the NHS would save millions of pounds, let alone billions. All right. So it's a good idea. If you can reduce it, go for it. Kishore.
Okay, thank you. Let's go to some more questions. Missed your diabetic program last week. Can I watch it on your link or on YouTube? Thanks.
My diabetes program.
No.
No, sorry, no. We had it. We had a
Can I
diabetic one
answer
last
that?
week. Yeah.
Yeah, let me answer that, Deepak bhai.
Yeah, sure.
Diabetic no program last year હતો. અને it wasn't the last week. Last week તો Ayurvedic no હતો.
Yeah.
પણ diabetic no, if you go on our site and if you search for it, you will find the recording there. But I can't remember when exactly it was.
Yeah, well, I think it was last year, just when, and yeah,
Yeah.
you're right. It's everything's on the SPA UK
Yeah.
website.
Did
Yeah.
I do it? I can't remember now.
Yeah, you
you
did.
may have.
Yeah.
I think you did it. Yeah.
Yeah, you did it, but it wasn't this year. It was last
It was
year.
last year.
Yeah,
That's right.
yeah.
Yeah. So that will be available on the SPA UK website.
Yeah. Thank you.
Any other questions?
What are your top tips for measuring BP at home?
Right. So simple. First of all, make sure you've got the right cuff and the right machine. All right. I have the Omron M2, which is about 30 pounds. I use it at work in my bag, but sometimes people have it. All right. So I sit down. This is my study. I do my paperwork and things here. I put the blood pressure cuff on, measure it. All right. And sometimes I stand up and do it, especially if I've been gardening and if I feel dizzy and I stand up, because I want to know if my blood pressure is falling or posture. I'm not on any blood pressure tablets. And as I said, for some reason, my blood pressure has all been low. But it's just the way my makeup is. All right. So sit down. If your blood pressure is high, give it a couple of minutes and do the blood pressure again. Make sure you're in a quiet room. Make sure no one's talking to you. Make sure you got the television off. All right. And make sure you're relaxed and do it. All right. I think that's, the British Hypertension Society and British Heart Foundation and what we call a big organization called NICE, National Institute for Clinical Excellence. They basically say the blood pressure readings at home are just as accurate or more accurate than doing a blood pressure in a GP surgery. So if you have time and you've got the machine, decent machine, do it at home and write it down, record it. See, when patients come to me, they write down all these blood pressures like this, So I get a yellow pen, and all the ones I'm not happy about are painted yellow, and I'll just show it to them and say, look, all those blood pressures are no good. If it's on average, if more of them are abnormal than that, then it may need treatment. And we have a discussion about treatment and management, weight loss, exercise, etc., or tablets.
Excellent, thank you, Harish. So I think just a few comments. I think iterate from everybody is that these are very informative sessions about what you've talked about today. So it's very, very good of people. I don't see any other questions unless anybody else has got any online.
Harish bhai, a question છે.
Yeah, go on.
Right. આજે તમે blood pressure ની વાત ને કરી છે. હવે I'm not sure. હું છે ને 2 tablets લઉં છું. Candistrani and Nebula. હવે એ 2 tablet છે blood pressure ની છે કે કઈ બીજાની છે?
So if you remember the slides, candesartan.
Yeah.
Okay, is a blood pressure. It's called an ARB, angiotensin receptor blocker. It's like valsartan, candesartan, they're all the sartans, all right? Irbesartan and whatever.
Yeah.
Now, what's the other name of the other tablet?
Nebula. Nebivolol.
Nebulalol. Okay,
Yeah.
that's a beta blocker. All right.
All right.
Okay, so again, it's not in my armory, all right, because I'm very old-fashioned. And if you ask me how many drugs do I prescribe on a day-to-day basis, it's probably no more than 20 to 25 drugs. I usually prescribe metoprolol, bisoprolol. That's okay. Nebulalol, it's a beta blocker. It's your GP's choice it's your GP's choice and what they're experienced with. So,
tablets it is not prescribed it's going back 20 odd years.
yeah,
Because
they're fine. Is your blood pressure controlled?
Blood pressure it's around 140, 145 over 80.
Yeah, and depending on your age, and I think you're probably in your 60s.
No,
70.
I'll be 72 next month.
Okay, so so it's a good blood pressure, all right? You see, I'm really quite liberal. I mean, it's if that's okay for you, that's fine, all right? But if you get it a little bit lower, that's okay as well. But your GP will know your medical history, your blood test, your thyroid, your cholesterol, your kidney test, and then judge it by that. But if it's 148, I don't get too fast, because you see, if I want to worry people, I can worry them so bad that they'll never come into my surgery, or they might want to go and pump, because they're worried about blood pressure. But as I said to you earlier on, right at the beginning, don't get too screwed up about blood pressure, because it goes up and down. It's not a problem.
Yeah. Bijou, a question or two.
Yeah.
Diabetic.
Mm-hmm.
Metformin which is just a standard tablet diabetic blood sugar every day check February I was in hospital. But ત્યાર પછી છે ને કે હું છેલ્લા 2 મહિના થયા કે ખાલી વીકલી એક જ વાર ચેક કરો. હવે જે તમે જે સ્કેલ કીધો ને 7A, તો આ જે મીટરમાં છે ને કે it's showing something like 142, 145 કે
ઇંગ્લેન્ડનું મશીન છે કે બહારનું મશીન છે?
એટલે actually એ મશીન છે ને બહારનું છે.
That's the problem, because our countryમાં machine હોય છે.
Yeah.
So they will measure up to 9, 10, 11, 12, all right? 145 is a different scale, all right? That's a millimole scale. And I think it's either from India or America or somewhere like that.
India
Yeah, so I'm not familiar with that scale, all right? Now, it's a good question about metformin, all right? Now, if you had no tablets for diabetes and your doctor said today that your hemoglobin A1C for the last 3 months was 50 and you need to go on the tablets, we've done it twice, okay? So they put you on metformin. So if you didn't take metformin, your risk of having a heart attack in the next 10 years is 40%.
Okay.
As soon as you take metformin, your risk of having a heart attack is down to 5%. So you have a choice, and I know which choice I would take. Go on the metformin, because it reduces my risk of having a heart attack by 35%. Now, some people have difficulty with metformin, all right? I prescribe a lot of something called slow release metformin.
Yeah.
Right? So dogs are barking, something outside. Slow release. That means the metformin comes out slowly in your blood. Some people take metformin straight away and they feel sick, all right? And they stop. They say, "Oh, I feel dizzy. I feel sick." So I'm a good prescriber of what we call slow release metformin, all right? And I usually prescribe either 500 slow milligrams, or if someone has got a A1C of 50, I'll put them on 1,000 once a day. 1,000 slow release. It comes out slowly in the blood for 24 hours, sometimes twice a day. But it depends on the blood level, the past medical history, everything I know about them. All right, but the slow release is better. So especially metformin has got side effects and they make you feel sick as well. Yeah.
Okay. I think there's
sorry.
Yeah, sorry. I was going to say we're going to make it the last question now, because we're nearly up to 10 o'clock, and I'm sure Harish Bhai needs a drink now after all of this speaking. So this is the last question. I know everybody's got more questions, but apologies for that. We're going to have to cut it. So last question, please.
Yeah, thank you. Go on. Which one is it? Someone just put.
Anybody's got any questions? So I think
there was something in the comment, wasn't it? Someone had put something about.
Yeah, they're only
there was one about kale, right? That was the last one I saw. That there was some obviously positive comments about the today's session.
Manu Mistry said, please note every GP has clinical. This is really an important point, Manu Bhai.
Yeah.
People they have clinical pharmacists and they do a good job, all right? they'll explain to you, they'll prescribe the tablets, they'll also do the blood test for you. But don't forget, a pharmacist is a pharmacist. Pharmacist is not a doctor. And if you are not sure, speak to the doctor as to what the pharmacist has said. All right?
Yeah. Thank you, Harish bhai. It's been really, really informative. And I know કે શાંતાબેને કોમેન્ટ નાખી હતી કે ગુજરાતીમાં માસી ઘણું બધું ગુજરાતીમાં સમજાવ્યું, પણ થોડું ઘણું તો પછી આપણે બધા અહીંયા રહીને અહીંયાના રહેવાસી થઈ ગયા છે, એટલે આપણે ઇંગ્લિશમાં આપણી લેંગ્વેજ બદલી નાખીએ છીએ. પણ જો તમને કાંઈ ના ખબર પડી હોય તો તમે મને કોન્ટેક્ટ કરજો, તો આપણે પાછા એની તમને સમજણ પાડીશું. પણ thank you very much for giving your time and for such a informative and knowledgeable session that you've given us. So on behalf of everybody, thank you.
Thank you very much.
And thank you everybody for attending.
Thank you.
Harish bhai. Thank you.
Thank you, Harish bhai.
Thank you, Harish bhai.
And
Bye-bye.
thank you everybody
Again.
for the great questions.
Thank you, Harish
Yeah.
bhai.
Thank you.
And also thank you to SPA UK for hosting this program. અમે અત્યારે કે એક વ્યક્તિ નહીં, એક જ ટાઈમે કે ઘણા બધા માણસો ને આમાંથી બેનિફિટ મળ્યું છે.
Thank you.
So
Thank
once
you.
again,
Nadia.
thank you very much.
Thank you.
Thank you.
Thank you.
Harish bhai. Talk again
Bye-bye.
later. Thank you. Bye.
Bye-bye.
Bye.
Thank you.